After a feast to your stomach, I'm sure you're all eager to get the feast for your brains on this international webinar, which is being conducted on the eve of International Day of Yoga 2021, organized by the Department of PG Studies in Swasthavrta of Jssamc Medical College. I'm very happy to introduce the guest speaker of first session in the afternoon scientific sessions, Dr. Kashinath sir, Dr. Kashinath Samagandi, who is working as Associate Professor in National Institute of Ayurveda, Jaipur. Sir has, along with the UG and PG degrees, with PG in Swasthavrta and Yoga, he also has a diploma in Yoga and Naturopathy of 3 years and is currently also pursuing PhD. His areas of specializations are Ayurveda dietetics and its modulation, Ayurveda lifestyle, and also the yoga. He is the academic council member of NIA. He has a very vast clinical as well as teaching experience of more than 12 years, and till date he has guided more than 15 PG students in their thesis and guidance. He has 4 published books as well as 2 monograms, more than 25 national and international journal articles in national and international journals, and 6 in health magazines and numerous articles in newspapers. He is a resource person. He was a keynote speaker and guest lectures in nearing 100 in various national and international webinars and programs conducted. He has a WHO project. He was the project coordinator for WHO during 2011 as a subject expert. He is an expert for protocol development for prevention of Madhumeha, which was done in All India Institute of Ayurveda, New Delhi. He is in the reviewer committee and member of numerous journals. To say few achievements and awards, he was the first rank holder in the Karnataka MD entrance test in this Swasthavrta Yoga branch. He has Ganga Sahaya Joshi Ayurveda Parangata Dhanvantri Award, which is being awarded by Vedic Samskriti Prachara Samiti during 2014. He has the Best Paper Award in International Ayurveda Conference, which was held in Coimbatore, Tamil Nadu. He has numerous medical camps. He has also visited many different countries, and to name a few, to Switzerland during 2018 for the 71st World Health Assembly. He also visited, I should say, 3 years ago for the International Day of Yoga. Sir was in China, Beijing, China. He was also there as a nominated member from Ayush Ministry in China during 2018. He was also in Kyrgyzstan in 2019 as a nominated Ayush member. And similarly, he has visited various other countries and has spread the knowledge of Ayurveda as well as yoga. Sir, we are honored to have you here. Over to you, sir, please.
Hope I'm audible.
Yes, sir, you are audible.
गुणत्रये विभेदेन मूर्तित्रयम् उपेयुषे त्रयीभूय त्रिनेत्राय त्रिलोके पते नमः सरस्वतीं नमो यस्यै प्रसादात् पुण्यकर्मिभिः बुद्धिदर्पणं संक्रांतं जगदाध्यक्ष वीक्षे ब्रह्मदक्ष अश्वदेवेषु भारद्वजं पुनर्वसु हुताशुवेश चर्कप्रभृतभ्यो नमो नमः पाताञ्जलिं महाभाष्य चर्कप्रति संस्कृतं. Good afternoon everyone, and welcome you all to afternoon session. The topic which I am going to discuss today is effect of yoga and on respiratory system. First of all, I would like to say that 50% of my job was done by previous speaker, especially Professor Arpan Bhatt sir. He dealt most of the points, classical points, and even theoretical aspect of yoga, and whereas Manjunath sir, he dealt about most of the application and even publications in yoga. So the part which is remaining is practice of yoga. So how to practice? Hope I will focus much on those points in this presentation, preferably to enhance the respiratory system. I would like to start the today's session with just rate and ratios of respiratory disease and their global burden. So according to the data of 2016, it says that near about 3.5 millions of people lost their life because of respiratory disease, and even 2.38 millions of people because of lower respiratory infection. Same thing when we see the impact of respiratory disease in 2017, same in 2017, near about 3.9 millions people lost their lives because of respiratory disease, and 2.56 because of lower respiratory infection. It says what is the intensity of impact of respiratory disorders on the lives of the humans. So here, just next to the cancer, the number is respiratory diseases. And even when you see the India's India is accounting near about 32% of respiratory disease globally. It's shared by the India. And one more very important data says that DALYS or DALYS rate. Here DALYS rate is nothing but disability adjusted life year, or even it in simple way, if I want to say that DALYS rate is that number of years lost by particular person, number of year lost by particular person because of disability, or because of diseases of respiratory disease, or because of losing his because of death, early death because of respiratory disease. So that is, here it says that in 2016, most of the states of South India, they lost their lives because of, they become crippled because of the impact of chronic obstructive COPD like conditions. It says that what is the impact of respiratory diseases on the global scenario. And even other than COPD, other diseases which is directly impacting on the respiratory system, or these things we all know in detail about these things: pneumonia, tuberculosis, emphysema, asthma, bronchitis. These are other diseases which is excessively seen related to the respiratory system. And when we think about the when we see the management, obviously we are well versed with the technology now. Every day new research is happening and new outcome is coming. But even after that, when we have lots of medications like antihistamines to tackle lots of respiratory diseases, NSAIDs, decongestants, and even anticholinergics, many drugs are there. But each and every drug has its own side effects. And to again, these side effects, again, it is giving extra burden over the global scenario. So that is the reason. So even after having such medications, but we are not able to get this satisfactory result by these medication. So at that scenario, it is ultimate to accept the concept of yoga, because it is a time to move towards the salitogenesis, in the sense we need to protect ourselves, we need to preserve ourselves, preserve our health, promote our health by accepting the yoga concepts. So that is, move towards the salitogenesis only happens when you preferably accept the concepts of yoga. So here in the context of respiratory health, yoga, obviously we know that it plays very important role. And even yoga science says that yavat vayu sthite dehi tavat jivanam uchyate maranam tasya nishkrantis tata tato vayu nirodayat. That is, if vayu is there, then only the person will live. If the vayu is not there, obviously person will end up with the death. So it is the main line of yoga which says that we need to protect our vayu, we need to protect our prana vayu. If you preserve your prana vayu, ultimately you can live long. So this is the main motto of yoga. So ultimately, yoga will be the right choice for the to maintenance of the respiratory health, and even to curb or to tackle all the respiratory disorders. So before we understand the concept of yoga, how exactly it is going to help in respiratory system, enhancing the quality of respiratory system, we need to understand bit very short, within a short time I will explain what is the, how exactly the mechanism, respiratory mechanism will takes place. If you have this idea in your mind, then easily you can make out which kind of asanas, which kind of kriyas, which kind of pranayama is going to affect which part of the body. So to understand the respiratory mechanism, so we need to understand the concept of three pressures. Or you sorry, you can consider it as a theory of pressure. So there are three types of pressure. One is atmospheric pressure, which is outside the body, and another is intra-alveolar pressure, which is inside the alveoli. Another is intra-pleural pressure, which is within the pleural cavity. So when we see the atmospheric pressure, it is almost it is 760 mm of Hg at the sea level, which is always stable. It is not subjected to the any fluctuation. But whereas intra-alveolar pressure, the pressure which is in the pulmonary, intrapulmonary pressure or intra-alveolar pressure, so that is more or less it is also equal to that of the atmospheric pressure, but it is not stable. The intrapulmonary pressure will go on fluctuating on the basis of day and night fluctuations. And another pressure, that is intra-pleural pressure, it is less than that of the intra-alveolar pressure, and it is stable. Intra-pleural pressure is stable and atmospheric pressure is stable. This which is changing is intra-pleural pressure. So whenever there is a pressure gradient, whenever there is a pressure variation, we in simple way, atmospheric pressure is greater than the intra-alveolar pressure, and intra-alveolar pressure is greater than the intra-pleural pressure. Because of this difference in the pressure, air pressure, the process of respiration will happen. If there is no any difference, obviously there won't be any formation of negative force. If there is no any negative force, or if there is no any negative pressure, then there is no any chance of entry of the air. So these variation in these pressure will create the process of respiration. First, you should keep this in your mind. And another is, we need to understand the concept of Boyle's law. Boyle's law, what he says that, Boyle's law says that whenever there is pressure and volume are they are inversely related. That is, when the volume increases, pressure decreases. When volume decreases, pressure increases. Why we need to understand this concept? Where when we inhale, we expand our chest. When the chest is expanded, obviously volume is increased. When volume is increased, pressure is decreased. Pressure in the sense, pressure in the lungs is decreased. It creates negative pressure, which allow us to breathe, or which allow us to take the atmospheric air. When we exhale, when your chest compress, obviously volume is decreased, pressure is more in the lungs. By that pressure, air is taken out, that is exhalation. So ultimately, on the basis of volume, on the basis of pressure, these things, the process of respiration will take place. Because this concept is very much important to understand how exactly asana is going to affect in respiration. Another very important phenomena which takes place, which helps in the respiratory system, is the stimulus received by the some of the receptors, preferably receptors like, one is stimulatory receptors, another is chemoreceptors. Stretch receptor. Stretch receptors are those receptors which are present on all musculature, which supporting the lungs, and even it is present in the over the deltoid, over the neck muscle, other accessory muscles which are involved in the process of breathing. So on these muscles, there will be a presence of stretch receptors. Whenever these stretch receptors receives the impulse from the, or receives the signals from the center, that is impulse from the medulla oblongata, then it will expand. When it expands, then obviously volume is increased, negative pressure increase, cause the entry of the atmospheric air into the body. In the same way, another receptor which plays important role in respiration is the chemoreceptors. That is, chemoreceptors, preferably they are present on the carotid body and on the arc of the aorta. So these respond whenever there is a variation in the oxygen level and whenever there is a variation in the carbon dioxide level. So when you attain the kumbhaka, oxygen level is carbon dioxide level is going to increase. That carbon dioxide level, again, it will break down into hydrogen ion. That hydrogen ion surpasses your blood-brain barrier, and it will trigger the medulla oblongata. Then that signal will again make the body to expand your chest. So these are the three very, very important phenomena which takes place in the respiratory system. One is pressure theory. That is fluctuation in the pressure will, again, there will be entry and exit of the air. Another is these receptors initiate stimuli to the all chemoreceptors and structure receptors. Another is the Boyle's law, that is pressure and the volume. These three concepts just keep in your mind when we discuss about the which kind of asana is going to affect in which way, that then it will be easily you can easily make out with these phenomena. So again, whenever you are planning for any kind of yoga, especially for the respiratory system, whether it is a Shathkarmas or Asanas or whether it is a Pranayamas, then we need to think that any asanas, any yogic kriyas, it has to fulfill these criteria. When any asanas fulfills these criteria, it indicates that particular asana or particular pranayama or particular Shathkriya is very much essential to maintain the respiratory health, and even it is very much essential to prevent the respiratory disorders. First criteria, asanas or kriyas or pranayamas, they are supposed to increase the lung volume. As I stated, as the lung volume increases, obviously pressure will be low. That will create the negative pressure. Because of that, atmospheric pressure, atmospheric air enters into the lung. So particular yogic kriya should be able to increase the lung volume. Another, whenever you are using any kind of asanas or kriya, we need to give more importance to the all the lobes, because we know that some research says that most of the time we use only two lobes of the lungs, that is mid lobe and lower lobes of the lungs are much used compared to that of the apex part. Apex lobes, that is upper lobes, are very minimally used. So if you start practicing such asanas or such kriyas which will activate these apical lobes of the lungs, then obviously the ventilation process will go on increasing. That is, the lung capacity will go on increasing. So we need to choose particular asanas which will activate preferably the apex part, which is very less used or less utilized. Another, muscle endurance. Obviously, we need to select such asanas which will increase the muscle endurance. Almost all the, especially muscles like intercostal muscles or extracostal muscles, diaphragm, or even neck muscles and trapezius muscles. These are some of the muscles which actively participate in the process of respiration. So if you participate in certain activities which increases the endurance of these muscles, obviously the process of ventilation you can enhance. And again, we need to follow such activity which decreases the air resistance and even better emptying of lungs, especially like Kapala Bhati and even Bastrika. That will help to take out all the air residue from your lungs. So you need to adopt certain things, certain activities which empties your lungs. If there is a complete emptiness of the lungs, then it will allow the fresh air to enter into your lungs. And even, as I stated, only not these three phenomena are involved in the process of respiration, but one more phenomena which directly or indirectly get involved in the process of respiration is the involvement of your psyche, isn't it? Whenever we exposed to the any kind of stress-like condition, obviously we will start gasping. Why it happens? Again, even after you are having physically, if you are fit, but even though if your psyche get disturbed, obviously then the hypothalamus, then the limbic system will get vitiated, ventilated. By that, again, it will receive lots of impulses from the medulla oblongata pons. Because of that, then the process of gasping will takes place. So ultimately, whenever you exposed to the any kind of stress, we need to cope up with those stress. Again, for to combat this stress like condition, which kind of asanas or which kind of meditation you are supposed to choose. So again, prevent the repeated infection. Even after you are physically fit, if you are exposed to the repeated infection, obviously that will also deteriorate the healthy status of the respiratory system. So these are the some of the criteria. Whenever you are selecting any kind of asanas, pranayama, shatkriyas or meditation, you need to see that whether particular things are fulfilling these criteria or not. So first come to the basic thing, because whenever we say that asanas for lung capacity improvement, or asanas which are preferably yogasana, which is indicated for improving the respiratory system, most of the time we think that pranayama is only the thing which helps to maintain the respiratory health. It's not like that, because even asanas plays very, very important role. If there is no any asana, if you just go for pranayama, then you may not be able to get all those outcomes what we are expecting. So that will be possible when you imbibe, when you incorporate the concept of asana, pranayama, and even dhyana, dharana, samadhi. So here again, along with that one, there are other some points which indirectly affecting the respiratory system, because most of the time we won't focus on these things. Just we focus on asanas or pranayama when it comes to the maintaining of the health of the respiratory system. Other components which indirectly affecting the respiratory health is place. Obviously, even though if you are healthy, but if you choose particular area which is not ventilated, if it is ill ventilated, if it is dusty, then obviously, even though if you are doing perfect yogasanas, but you may not get the good result, because that ambience is not compatible to you. Because of that ambience adverse effect, adversity, that will affect your respiratory system adversely. So whenever you are choosing the place, ultimately it should be clean, well ventilated. And even in corona like conditions, we are making the people who are isolated in their house, at least they should remain in particular room which is well ventilated. If there is a ventilation, then possibility of respiratory infection will go on decreases, and even it will helps the lungs to improve his vital capacity or lung capacity. Another very important part is choosing the mat. Nowadays many mats are available, preferably like PVC, polyvinyl carbon material made yoga mats, and even there are TP, that is thermoplastic elastomer made mats, because some studies are saying that excess using of these mats, they are non-biodegradable. It is these types of mats are anyhow they are vitiating the environment. But moreover that, when these mats get heated, because most of the time when we practice yoga, sometimes sunlight will fall on that one, or sometimes when we vigorously follow any yogic kriyas or yogasanas, your body will get warmed up. In that warm condition, if you lie down, and it will these kind of mats will release us very minute toxic gases that may enter your respiratory system, and it may disturb. And you may think that we are doing all the kriyas, we are doing all the asanas, why, even though why I am falling sick, preferably of the respiratory system, because we are not focusing the which mat is supposed to be chosen. Because here they says that their antimony like toxic materials also released. You might be seeing that after using particular yoga mats for 15 days to or 1 month, there will be there some some powder like component will start coming out. So if it is coming, and if you are going and if you are practicing asana with a deep inhalation and deep exhalation, sometimes in deep inhalation such component may enter into your body and it may affect you. So whenever you are choosing the yoga mat, classically they said that kushasane, vyagrajine, mrugajine, kambalaha, stulasine, samasita. So samasina. So he says that best way to choose the best material is that kambala. Kambala is cotton made. Nowadays cotton made, and we need to become local for vocal for local. So if you go for accepting the Kambala, that is cotton made bed sheets, that may be helpful to tackle such like conditions. Or else mats, especially in recently I came across one paper article. There is a one association in the Chennai where they prepare mats by natural rubber. So if it is made out of natural rubber, then that will be a safer thing. Or if it is made out of cork material, then that will be safe. More or less, better you choose Kambala, that is cotton made. So classical reference is that Kambala can be taken for the taken as the yoga mat for routine yoga practices. So instead of choosing such mats, better you choose cork or pure rubber made, or else you can go for cotton mattings, because most of the time we won't focus on these things, just we will focus on the pranayama. But before preparatory, there are other factors which is affecting your respiratory health. Another very important, clear your bowels, because whenever we practice asanas, it's a ethical practice of yoga says that you should practice particular asanas in empty stomach, or like 3 or 4 hours after consuming the food, preferably empty stomach. When you are practicing this one in empty stomach, then obviously there won't be any chance of any ailments. But if the bowels are not clear, again, if you are going for practicing the yoga asana, preferably forward bending or forward bending like asanas, obviously it will put the pressure on the abdomen, which will reduce the activity of the diaphragm. If diaphragm activity is reduced, obviously there won't be good expansion of the lung. So ultimately you need to if you want to maintain the respiratory health, it is must that even you should clear bowels and you should practice. So see, these are some of the preparatory things which are supposed to be kept in your mind when it comes to the respiratory health with reference to yoga. Another part, very important part, is that when we think about respiratory system, most of the time we end up with respiratory system includes only trachea, bronchiole, and lungs and alveoli. So we will end up here. But there are other parts, preferably even other parts like sinuses. Sinus even need ventilation. If there is poor ventilation in the sinus, especially it may be frontal sinus or maxillary sinus or ethmoid sinus or sphenoid sinuses. If there is no any proper ventilation, then accumulation of lots of mucus like material will go on happening, which will lead to the repeated infections. So when we think about the respiratory health, even we need to focus on these sinuses, because if they are not proper, then again indirectly it will affect whole respiratory system. So when coming to the sequential order, which kind of yogic kriyas will helps to maintain the respiratory health, we will start from the Shathkarmas in sequential order. We all know that dhauti, neti, kapalabhati, nauli, basti, and trataka. These are the some of the Shathkarmas which are preferably advised by the yoga. So here preferably dhauti is the one of the methodology which is helpful to cleanse the lower respiratory system. Neti is the one of the modality. It may be Jalaneti, Sutra Neti, Dugdha Neti, ya Kshira Neti, any Neti. Neti helps to cleanse the upper respiratory system. And Kapalabhati, so Kapalabhati not only cleanses your lower respiratory and upper respiratory, even Kapalabhati has capacity to cleanse your even sinus. So Nauli, Basti, Trataka also have some of the effect over the respiratory system, but directly Dhauti, Neti, Kapalabhati has direct impact over the enhancing the respiratory system. And even there is a beautiful reference in Atayo Pradipika that Shatkarma Nirgatastaulya Kafadosha Maladikaha. Whenever the body is excessive of Meda and Sleshma like malas, then ultimately Shatkarma plays very important role. That is Shatkarma Nirgatastaulyam Kafa Maladikaha. So, and even Ayurveda says that Urdhva Jatrugata Bhaga is dominant of Kapha. Ultimately, because of kapha dominancy, or even respiratory system is very much endangered with the excessive accumulation of the kapha. So if you want to prevent yourself from the excessive accumulation of the kapha, then Shat Kriyas are very much essential, because it is said that Shat Karma Nirgatastaulya Kafadosha Maladikaha and Pranayamam Tatam Kuryat Anayasayana Siddhati. So if you practice pranayama after Shat Kriya, then you need not to put more pressure to get the siddhis. They said that Anayasena Siddhati. Pranayama, if it is done after Shat Kriyas, then you can easily conquer the pranayama, and you can easily get all the siddhis. That is the impact of Shat Kriyas. So Shat Kriyas will helps to cleanse your body, and preferably upper respiratory, lower respiratory, and even including the sinuses. So coming to the Kunjala Kriya in Shat Kriyas, this is one of the research article which says that how exactly Kunjala Kriya is nothing but it is a part and parcel of the dhauti, or it's also called as it's also called as Vamana Dhauti, Kunjala Kriya or Vamana Dhauti. So here this study says this was the research study undergone on two groups. One is on new practitioners, another group was routine practitioner who were experts. So among them they conducted this study. So for the people who are already a good practitioners, among them they made people to practice the Kunjala Kriya. So after the Kunjala Kriya, then they got tremendous changes in their body, preferably in the respiratory system. That is, on the basis of assessment criteria, they came to know that one, it will increase us the vital capacity, it will increase us the forced inspiratory volume, and even it will reduce us the expiratory residual volume, and even it will reduce us the respiratory rate. Ultimately, why we are going to practice the pranayama? Ultimately, to slow down the breathing rate. If the respiration rate is low down, then the lifespan will go on increasing. So here Kunjala Kriya itself helps to reduce your respiration rate. And what was the reason behind how exactly Kunjala Kriya is going to affect your respiratory system? Again, they said that voluntary involving in the vomiting, that is VIV, is nothing but voluntary involvement in vomiting, that is Kunjala Kriya. It will improve the endurance of all the muscles which are involved in the respiratory process, and even it will decrease as the resistance, and even it will helps in the better emptying of the lung, and even it will helps to initiate the vagal predominance. So these are some of the research data says that how exactly Kunjala Kriya will help to improve the musculature, improve the stretch reflexes which are present on the musculature, which helps to improve the muscle endurance, muscle capacity, which helps to improve the vital capacity by these things. So, and another very important interesting point, which are because Jiva Dhauti is nothing but in simple way it is cleansing of the lung, cleansing of the tongue. So usually we most of the people will follow that tongue cleaning soon after the Danta Dhavana, but here preferably with respect to the respiratory functioning, there is a study saying that the people who are regularly indulging in the tongue cleaning, so that will helps to improve the peak expiratory flow rate, that is PEFR. Peak expiratory flow rate is increased when you practice Jiva Dhauti. See, this is also says that Dhauti Kriya, it not only restrict itself to the Vamana Dhauti, even Jiva Dhauti can be applied to maintain the respiratory system. And another, not to this context, respiratory system, but there is one more research study says that just activating some of the taste bud, especially TAS2, TAS10. These are some of the receptors which are present on the taste bud. If they get activated, that will help to maintain the innate immunity. So that is the reason in corona-like conditions, we need to make the person to follow the Jiva Nirlekana, because that will initiate the innate immunity. So once innate immunity is improved, obviously the person doesn't fall sick for any respiratory infections. So in the same way, Jiva Dhauti also helps to maintain the respiratory system. And another very important part is Kapala, randhra, dhauti. So here Kapala, randhra, dhauti, as a Kapala word itself refers to the cranium. So here dhauti, which will helps to clean the cranium. Here cranium, even it refers to the all the sinuses. As I stated, if there is any deposition, collection in the sinuses, that will one or other day it will leads to the conditions like sinusitis, and indirectly it will put the resistance to the normal entry of the air. So ultimately we need to accept such activity which will reduce us the air resistance. So for that, Kapala, randhra, dhauti, because we never practice. I discussed with many people, but they never practice Kapala, randhra, dhauti. Just they will read and they will they will leave, but they won't practically they practice. So how to practice Kapala, dhauti? Just I will show you some small video. Organizer, is my video is visible?
Yes, sir, it is visible, sir.
Yeah. So here, how to practice Kapala, randhra, dhauti? This helps to take out the accumulations in the sinus, whether it may be frontal sinus or whether it is a ethmoidal sinus or sphenoidal sinus or even maxillary sinus. To ventilate all the sinuses. So they there are 5-finger technique. Just to keep in your mind, you can just recall 5-finger technique. First technique is that just rubbing the hands over the forehead. When you rub the hand over the forehead, that will helps to cleanse the frontal sinuses. And another 4-finger technique. So 4-finger technique, here 4 fingers are used, preferably to cleanse the ethmoid, sphenoid as well as maxillary sinuses, just rubbing 5 to 10 times regularly. And next is 3-finger technique, using the 3 fingers to press the eyebrow and upper part of the eye. So when you pressure again, that will also helps to cleanse the, take out the all the depositions of the frontal sinuses. So this is the way how you need to practice. Another is 2-finger technique. So this will helps to cleanse all the orbit area, even though if there is any presence of any fluid or any accumulation, that will helps to drain the things into the nasal tract and that is taken out. Another is 1-finger technique, which will helps to take out the accumulation which are present in the temporal region. So in such a way, if you adopt even Kapala, randhra, dhauti, and most of the time these techniques are used in the facial massage, and even people who are going for in beauty parlors, usually such kind of techniques are used. If you regularly, because they are part and parcel of dhauti, Kapala, randhra, dhauti refers to the cleansing of all the cranial sinuses. So if you adopt this one, that will even helps to prevent the things in the sinuses itself, and even it will helps to maintain the sinus health. And another is Mukha dhauti. See again, Mukha dhauti, again it is also very leastly practiced. How exactly Mukha dhauti is supposed to be practiced? Here in Mukha dhauti, there are 3 stages, or you can consider them as a 3 level. First level, preferably it is like a warm up. You can consider it as a warm up technique. Stage 1. Here what the person is supposed to do is that one hand should be kept on the abdomen and he should inhale. As soon as he inhale, he should bulge his abdomen, and while exhaling, he should exhale from the mouth. Inhale through the nose, expand the abdomen, exhale through the mouth. This is the stage 1, and this stage 1 can be practiced whenever you want. There is no any special indications and contraindication. Throughout the day, even you can practice whenever you want, because it is very easier one. So there is no any special limitations. Stage 2 has bit limitations. So here, whenever you are practicing Mukha dhauti stage 2, Mukha dhauti helps to enhance the enhance the endurance of the respiratory muscle, and even it will helps to improve the expiratory volume. So to practice Mukha dhauti stage 2, first you need to bend forward and you should place the hand or the thigh. Then same, inhale through the nose. As soon as you inhale, bulge your abdomen, and as soon as you exhale, exhalation should be done on through the mouth. When you exhale, you should suck your abdomen. So in such a way you should do, because you might be seen that whenever athletics, whenever they will involved in any athletic like event, soon after running or soon after event, suddenly they will start expelling the air from their mouth. That is nothing but the Mukha dhauti. Mukha dhauti helps to relax your body instantaneously, and even it gives more chance for the entry of the fresh air into the lungs. So Mukha dhauti stage 2, and third stage is that similar to that of the stage 2. Here inhale through the nose, bulge your abdomen, exhale through the mouth, and suck the abdomen. After that you need to adopt the Jalandhara Bandha. Then it indicates that we are ending towards the Kevala Kumbhaka state. So what is the importance of Kevala Kumbhaka? Kevala Kumbhaka is that when you expel all the air after the tidal volume expiration, if you hold the breath, if there is no any entry of the breath, entry of the air into the lungs, then that is called as a Kevala Kumbhaka. Kevala Kumbhaka will give sufficient time for the internal respiration. Whatever the oxygen molecules present in there, your alveoli, that are completely utilized by the each and every cell, and even each and every cell will release the carbon dioxide, and that is completely received from the lungs. So that is the reason Kevala Kumbhaka followed by Jalandhara Bandha will help to attain the Kevala Kumbhaka. So this is the one of the Mukha dhauti kriya which we are not supposed to practice to maintain the upper respiratory system. Even it will helps to enhance the muscular endurance of all the respiratory system. The next, as I stated, Jalaneti. And even in dhauti, there is a direct, all kind of dhauti. Classically, they says that kasa, shwasa, pliya, kusta, kafarogascha vimshati. So, dhautir karma prabhavena. When dhauti kriya is done very appropriately, it may be Jala dhauti, or it may be Varisara dhauti, what we call Shankha Prakshalana, Kunjala kriya, or Vamana dhauti, or Mukha dhauti, or Jiva dhauti. Whichever dhauti you do, it preferably helps to reduce the conditions like Kasa, Shwasa, Pliha, Kustam, Kafarogascha Vimshati. That is 20 types of Kafaroga can be prevented. As I stated, Urdhva Jadrugata Bhaga is Kafasthana. Kafasthana, being a Kafasthana, obviously respiratory system is preferably affected by Kafa like doshas, isn't it? Whenever there is excessive accumulation of the kapha, ultimately it will show its impact on the respiratory system. So to cleanse your body from the kapha, excessive kapha, and conditions like kaphaja vyadhis like kasa, shwasa, pliha, kusta. We know that kusta is sneha pradhana vyadhi, snigdha pradhana vyadhi. It is a kapha pradhana vyadhi. So even in kusta like condition, it plays very important role. Kasa, swasha, preferably these are related to the respiratory system. Kafarogascha vimshati dhautir karma prabhavena. So this is the impact of dhauti kriya. Once if you practice these things, that will helps to prevent all the kaphaja vyadhis which is affecting your respiratory system. Another very important shatkriya is jalaneti. Again, research study says that nasopharyngeal wash, that is cleansing your nasal tract with the saline water. Especially this was the recent research data over the COVID-19. They says that one continuous for practicing the nasal irrigation will prevent the infection or will prevent the multiplication of the virus, because they says that one saline water, especially saline NaCl, when it interact with the each and every cells of mucus of the nasal tract, then that will produce us the hypochlorite ion. Hypochlorite ion itself act as an antifungal, antiviral, and even conditions like mucormycosis, what we call black fungus. Even in black fungus like condition, hope it may help to prevent the conditions. So it will HOCl, hypochlorous ion, act as an antiviral, antifungal, and antibacterial. Even jalaneti concept also says same thing. Just every day you need to practice jalaneti. Jalaneti will helps to cleanse the all the nasal tract, preferably upper respiratory system. And even here after jalaneti, we need to do certain prakriyas to take out the water droplets, because after doing Jalaneti, if you don't do any attempts to take out the droplets from the sinus, then that may leads to the sinusitis like condition. So soon after Jalaneti, people are made to practice the Kapalabhati or Bastrika. Why? Again, Kapalabhati, Bastrika, indirectly it will help to enhance the strength of the musculature of the respiratory system. Especially it will enhance the endurance of the intracostal muscle, extracostal muscles, and even diaphragm. So in such a way, Jalaneti is going to affect, enhance the respiratory system. It can be practiced every day, but preferably under the direction, if you train, then that will be well and good. And while explaining the importance in Hatha Yoga and in Geranda Samhita, they says that Kapala Shodhanam Chaiva Divya Drushti Pradayanihi Jatrurdha Gata Rogan Neti Rashu Nihanti. Any instantaneously it will reduce us the Jatru Urdugata Vikaras. See how beautifully he says that Kapala Shodhanam Chaiva. So Jalaneti also helps to cleanse all the sinuses. Kapala Shodhanam Chaiva Drushti Dosha Pradayani. Even it will helps to improve your vision. Jatrurdva Gata Rogan Neti Rashuhu. That is, it will helps to prevent the Jatrurdva Gata Vikaras as early as possible. Ashukari. It has Ashukari. So this is the impact of Jalaneti. Every day you can practice Jalaneti. It is mandatory that after Jalaneti you need to take out the water by practicing appropriate Kapalabhati or Bastrika. Then next, after practicing, once if you cleanse the body with the Shatkriya, one among the Shatkriyas, then we will proceed to the Asanas. So again, Asanas, there are many Asanas. There are lots of research work says that how exactly it is going to improve the respiratory or lung capacity or vital capacity, how many research are there. And especially these are some of the research data which directly says that involving yourself in the yogasana, preferably physical yogasanas, that is asanas, that will going to increase the respiratory function. So here, just a minute, someone is again, this is also one of the asanas. Here I am not going to mention all the asanas because here in this study, see 15 positions, 15 types of asanas are used, which and outcome of this research says that it increases the all vital capacity and even respiratory function. So here preferably asanas like Vrikshasana, Trikonasana, Natarajasana, Padahastasana, Chakrasana, Vakrasana, Paschimottasana. These are many varieties of asanas which are used. But I need to say one thing, whenever, as I stated earlier, in the lung, only the two lobes, middle lobe and lower lobes are used. Apical lobes are very less utilized. So we need to practice such kind of asanas, even which will activate the apical lobe of the lungs. So how to, which kind of asanas activate the apical lobe of the lung? So we will start with the Sukshma Vyayama. We know that Sukshma Vyayama will helps to improve the peripheral circulation. Once the peripheral circulation is improved, obviously it will helps the especially lungs to expand. And even Sukshma Vyayama, again there are many types of Sukshma Vyayama from head to toe, but preferably if you opt for Surya Namaskara, because there is a research study which is undergone on the medical student who practiced Surya Namaskara regularly, there was a improvement in the pulmonary functions. So here, which kind, again Surya Namaskara, there are varieties of Surya Namaskara. I preferably you should go for practice of 14 step of Surya Namaskara. So why I want to say about 14 step of Surya Namaskara, as I stated, even you need to activate the apical lobes. So here in 14 step of variation, this is the concept of S. Vyasa Bengaluru. So they incorporated two asanas extra here. Soon after the Samatita asana, soon after Tula asana, the person is made to practice the Sjashankasana. When you do Sjashankasana, ultimately even these the neck accessory muscles and even the preferable the extra intercostal muscles are completely stretched. When you do this one, obviously even it will start activating the apical lobes. So after the fifth step, step, that is after the Tulasana, Shashankasana is advised. So in the same way, after the Parvatasana, even again they are going to practice the Shashankasana. So if you accept this kind of Surya Namaskara practices, then that may help to utilize the all the lobes of the lungs by enhancing the what we call like a perforation and ventilation. So once the perforation, not perforation, profusion, once the profusion and once the ventilation is increased, ultimately the whatever we are inhaling the air, that is completely utilized. So this is one of the 14 step. Another variation, just I say that you can adopt this one even to utilize the all the lobes and even to enhance the endurance of the all the musculature which are involved in the breathing. Preferably here after the Ashwa Sanchalanasana, if you go for practicing the Virasana variation, if you just extend and if you just pull your body, if you make an arc, again see here all the lungs and all the adjacent muscles will be enhanced. So if you incorporate such variations, that may help to improve your lung function. And as just I had given just a brief asanas, which kind of asanas can be used to activate the apical lobe and mid lobe, like Uttita Tadasana, Ardhakati Chakrasana, Mandukasana, Bhujangasana. You people know that one. So and even middle lobe, Parivartita Trikonasana, but see one thing, when we say that if the person is regular practitioner, then he can practice certain advanced, not advanced, bit moderately hard asanas like Parivartita Trikonasana, Parivartita Parshokonasana. So but layman can't practice these things. At that time, we need to go for certain alteration or with the help of probes. So these are some of the asanas which are preferably indicated to enhance the respiratory system, like Padahastasana, Ardha Chakrasana, Parivartita Trikonasana, and Janu Shirsasana, Uttita Janu Shirsasana, Parivartita Parshvakonasana. And this is very simple one. Everyone can do this one. That is Shashankasana. Paschimottasana, it will be a bit challenging. Vakrasana, Ardha Matsyendrasana, and Ustrasana and Marichasana. These are bit moderately tough, and again these are easier thing. But instead of this one, if you make even laymen to practice and take the advantage of asana, if you need to advise with the prop. So here classical practice of Ardhakati Chakrasana, we all know that. But blunder what we do is that, so when you take your hand up, when you take your hand up, you need to pull the shoulder up. When you pull the shoulder up, obviously it will shows its effect over the apical lobe. So just we will rising hand and bending other side is not the Ardhakati Chakrasana. If you rise and if you pull your hand up, then that will helps to enhance the apical lobe by activating the musculature which are present in this way. So this is the classical way. And as I stated, everyone can't do this one. Then you can go for some alteration Ardhakati Chakrasana, especially by sitting. By sitting, even you can, even in office, if the person is free, then even with the help of chairs, he can practice the Ardhakati Chakrasana. Even this will help to utilize all the three lobes of the lungs. And this is another variation of practice of Ardhakati Chakrasana. So just Manduka, Uttana Mandukasana, we know that even in post-COVID regimen, yoga regimen, there is a advice of Uttana Mandukasana, and even International Day of Yoga protocol, even there is a Uttana Mandukasana. See here, Uttana Mandukasana, obviously this will also helps to enhance the or improve the lung space, and indirectly it will helps to improve the respiratory system. And again, same Upavishta Uttita Mandukasana. If the person is not able to sit in Vajrasana for longer time, he can sit on the chair and he can practice in such a way. See one thing, you just observe here, when you place your hand here, if you with the other hand, if you with the support of other hand, if you stretch hard, then that will helps to activate, that will helps to pull, or that will improve the circulation to the all the musculature of neck and other chest muscles. So see here, pulling and placing the hand on the opposite part, pulling and placing the hand on the opposite shoulder, again this will helps to improve the respiratory system functioning. Then Balasana, and this is best asanas to improve the respiratory functions, or even it's like child pose, just lying down, just staying there for a while. Exhale, we should bend, exhaling, and after exhaling, attaining the final posture, you need to go for normal breathing. and altered Bhujangasana. Bhujangasana will activate all the receptors, all the stretch receptors which are present on the lung musculatures, especially all the, like, it may be intracostal, extracostal, or diaphragm, and even neck muscles, accessory muscles. If you want to activate vigorously, then you can go for altered form of Bhujangasana practice. Meru Asana is nothing but just what we call mountain pose or Parvatasana. Again, Parvatasana will help to activate the apical. When you practice, you need to bring your head down as much as possible. If possible, try to touch the head to the floor. So videos I made bit fast forward, so that because you might be looking bit running fast, but to cover most of the asanas, just I made a fast forward. So again, these are some of the other asanas which will activate the lower lobe, and overall activation of the all the musculature and all the stretch receptors. These are the Purna Ustrasana, Dhanurasana, Chakrasana, and especially to strengthen, as I stated, even abdominal muscles are also plays very important role to give the larger space for the inspiration and expiration. So that will be done when you practice Paschimottanasana, which is going to strengthen the all the abdominis rectus muscle, and which will help even to descend or to contract properly and descend the diaphragm. So that is the reason, to strengthen the diaphragm and to strengthen the abdominal muscles, you need to go for practice of Paschimottanasana, Parivartita, Ekapala Janushirasana, Setubandhasana. Then next is Pranayama. So here, Pranayama, ultimately, we know that Pranayama helps to improve the respiratory functioning, or it will improve the vital capacity. So again, while adopting or while practicing pranayama, we need to choose particular postures. We know that if the person is not able to do the Padmasana or Siddha Yoniasana or Siddhasana, then we advise them to go for Sukhasana. If you are able to sit in the Padmasana, you need to practice Padmasana, because some data says that Padmasana will give larger space for the diaphragm to get descent. When if diaphragm get down, obviously the space of the lungs will be widened. Once the space is more, then the chance of expansion of the lungs will be more. Then there will be a chance of good oxygen entry. So these are the some of the like Siddhasana, Sukhasana. Just I shown Siddhasana, Padmasana. These are some of the pranayama posture, yogi meditative posture adapted to the pranayama. So again, breathing exercise. Nowadays in COVID-19, we are saying that these there are lots of breathing exercise, but these are some of the breathing exercise which will help to activate. See this inhaling and raising the hands. This will activate the lower lobe of the lung. Especially how it will activate the all the musculature. It will improve the endurance, and this widening your hands will activate the middle lobe of your lung. And same thing, another way to activate the apical lobe is that we need to we need to join the fingers, and you should rotate and you should take up. So when you do this one, skin, even including skin, it get pulled. When the skin is also pulled, obviously skin has lots of dermatomes. Even it will send the message to the cranium. By that, even all the lobes of the lungs are get activated. So interlock the fingers, rotate. It is very important. Every time you practice, you should interlock and you should rotate. It's not that once if you interlocked and once if you kept rotated, you should not keep always like this. Every time you practice, you open the interlock and again interlock and twist. Because of this repeated twisting, this even skin get stretched and even all the musculature will get stretched. Bastrika, again, Bastrika says that Bastrika pranayama preferably helps to improve the strengthen the respiratory muscles. This is one of the study changes in lung function measures following the Bastrika pranayama. Bastrika pranayama will strengthen the respiratory muscles. So Bastrika, if you want to improve the strength and endurance of the musculature, then best is to practice the Bastrika. And even this is again another research article which says that regular practice of Bastrika pranayama will strengthen the respiratory musculature, and which in turn leads to improvement of the lung function. And this is preferably done in the elderly subjects. So how to practice Bastrika? See, Bastrika classically they says that you should inhale through the nose and exhale through the nose. Active exhalation and active inhalation. So, but if you make use of the both the hands to inhale and exhale, ultimately even the musculature will get strengthened. Endurance of the muscles, all the muscles will strengthen. Once muscles are strengthened, obviously you can take the much advantage of the Bastrika, like pranayamas. And next, Kapalabhati, as I stated, again here Kapalabhati, preferably it comes under the Kriyas. But why is stated here in the Pranayama context? Because to practice all sort of asanas, Shatkriyas act as a Shodhana Kriya, cleansing. Even if you want to practice Pranayama and if you want to take the advantage of Pranayama as a cleansing procedure, you can adopt Kapalabhati. And sometimes Kapalabhati can also consider as the Pranayama. Because in the morning, Manjunath sir was saying that when you practice Pranayama, Kapalabhati continuously for 30 to 40 strokes, soon after practicing, you will be having the pause of, there won't be any inhalation and exhalation. There will be a complete Kumbhaka state is appeared. That is the reason soon after practicing Kapalabhati, Kumbhaka state is achieved by its own. That is the reason it can be considered as the type of Kumbhaka, but it is nowhere mentioned in the Kumbhaka context, but it's just analyzing because Kumbhaka state is attained. That is the reason it is better to practice before pranayama. So here again, Kapalabhati, how exactly it is going to help? Again, as before Bastrika, even it is also going to help the improve the strength of all the muscles. This is the 6 week of Kapalabhati pranayama training in the young healthy volunteers showed statistically significant increase in the pulmonary function parameters. And one thing you need to keep in your mind, preferably when it comes to the Kapalabhati practice, only one study I came across, that one, excessive indulging in the Kapalabhati pranayama will leads to the conditions like pneumothorax. It is a case report. When they interacted with that person, then they came to know that when that person used to practice the Kapalabhati more than 100 strokes per minute. So that was the main, they are just, it's a hypothetical answer. They are suspecting that may be the reason why the person is ended with the pneumothorax. That is the reason whenever you are practicing pranayama, even though it is very easy, but they says that yuktam tyajet vayu yuktam purayet yuktam badniyat tato vayu nirodayat. That is vayu, even vayu, to practice pranayama, it should be very easier. You should increase the practice of pranayama very slowly. Padamshika krama. You are not supposed to all of a sudden jump and you are supposed to practice the Kapalabhati for 40 to 50 times strokes per minute. No, it is not like that. Gradually you can increase your stamina to practice the Kapalabhati. And here, when to stop the Kapalabhati? This is usually most of the people will ask, sir, Kapalabhati kitne der tak karna hai? Kuch log karte 500 bar stroke dete. Nahi. So there is a very easy, simple method. It's my own practices. When I do Kapalabhati, so per minute 20 to 30 strokes I give, and I will give the pause of 2 or 3 minutes. Again, I will go for giving the strokes for 20 to 30 minutes, 30 strokes. But you should do till you feel the construction of the perineum muscles. So there is some stage you will get that you will reach particular stage when your perineum muscles will start contracting. Once if your perineal muscles will start contracting, it indicates that you reached the highest limit. Even after that one, if you go on practicing, then you may end up with the complaints like pneumothorax. So even though it's a pranayama, but you should be very vigilant enough when you are practicing, because while explaining the importance of pranayama, they said pranayama yuktena yoga sarva roga kshaya bhavet, ayuktam yogam abhyasam sarva roge samudbhava. Pranayama, if it is done absolutely according to the classic, then it will help to take out all the disorders. If you don't follow the rules and regulation, then you will end up with the sarva roga samudbhavet. Again, these are some of the studies which says that how exactly Kapalabhati is going to improve your cardiovascular and respiratory changes. Here, preferably, they says that one, it is by the way of by improving the endurance of the musculature and activating all the stretch receptors. And another is that as I stated, after practicing 30 to 42 strokes, you will attain the Kumbhaka. That Kumbhaka stage will send the stimulus to the chemoreceptors. Then chemoreceptors send the stimulus to the central receptors. From there, again receptors will be sent back to the musculature of the lung. Because of that, lungs will start expanding. Once lungs get more, provides more volume, obviously air will start entering into the lungs. So this is the way how Kapalabhati is going to work. So this is the practice of Kapalabhati. As I stated, we all know that active exhalation and passive inhalation. So, and 20 to 30 strokes at single stretch. Then you need to give pause for 20 seconds or 10 to 20 seconds. Again, you need to practice. Practice should be until that you feel the contraction of the perineum. Once if you start getting, then you should stop practicing the Kapalabhati. And Anuloma Viloma Nadi Shodhana Pranayama, we all know that how to practice, that is alternate nostril breathing. And even there are direct classical references that how exactly Nadi Shodhana is going to help your body to attain all the siddhis, that is Malakulashu, Nadishu, Marto Naiva Madhyega. That is Katam Sad Unmani Bhava Karma Siddhi Katam Bhavet. He says that one, if the Mala, if there is any obstruction in the Madhyama Nadi, that is Sushumna Nadi, Malakulashu, Nadishu, Maruto Naiva Madhyaka. If there is any obstruction in the Madhyama Nadi, there is no any easy movement of Maruta, Pranavayu. If there is no any easy movement of Maruta in the Madhyama Nadi, that is Sushumna Nadi, then you are not going to attain the Sthirata in the Mana. So Anuloma Viloma or Nadi Shodhana is that which will helps to take out the all the malas from the all the nadis. They says that pranayama ireva sarvam prashushyanti malahiti. To take out all the malas and malas by shushka, by drying it, then pranayama helps. Pranayama will help to dry the all the malas. But whereas Shathkarmas will help to cleanse all the malas, that is the chedana of mala will be done by the Shathkarmas, but shushkata or drying of the mala is done by the pranayama. That is the reason Anuloma has its own effect on your body. But coming to the effect of Anulom Viloma on the like increasing the respiratory health, obviously there are studies saying that it will help to tackle the conditions like bronchial asthma and mild to moderate severity of bronchial asthma. Again, 12 weeks of practice of Anuloma Viloma, again it will help to increase the respiratory function. This is the study which is done on healthy volunteers. And again, influence of alternate nostril breathing, that is results suggest that general there is a tilt towards the parasympathetic nervous system. So here, while explaining the Nadi Shodhana Pranayama, they says that one pranam cha idiyam pibet nityam, pranam cha idayam pibet nityam. While practicing the Nadi Shodhana, you should inhale from the left, then exhale from the right, then inhale from the right and exhale from the left. But most of the people will practice Nadi Shodhana starting from the right inhalation. No, classically they says that pranam cha idayam pibet nityam. Any ida is nothing but the eda, that is left. If you inhale from the left, even inhaling from the left, exhaling from the right, inhaling from the right and exhaling from the left. So here, if you do classical method of Nadi Shodhana, that will help to initiate the parasympathetic nervous system. As I stated, even though if you are physically fit, but if you expose to the lot of stress, that will also activate the chemoreceptors and it will give the conditions like gasping. So to cope up the stress-like condition, we need to activate the parasympathetic nervous system. That is possible when you practice the Nadi Shodhana, that is starting from the left inhalation, right exhalation, right inhalation and left inhalation. Or else you can go for practice of the cooling pranayamas like Chandra Anuloma Viloma, Chandra Vedana, Shitali, Shitakari, Sadanta, Shitali. So I know I don't want to show the video of Anulom Viloma, everyone know. And Brahmari Pranayama, again, this is very important thing. Nowadays, people are speaking much about the Brahmari Pranayama because Brahmari Pranayama practicing will enhance the improve of the nitric oxide secretion in the nasal tract. The nitric oxide will helps to keep your, it will relax the all the musculatures, especially all the small muscles, fibers which are involved in the breathing. So when the muscles are relaxed, then obviously entry of the air will be more. So this how it's happening. It is because of nitric oxide. And nitric oxide, not only it will relax your vessels or relax your bronchioles or trachea and branchia, but even nitric oxide itself has the anti microbial activity. That is the reason nowadays we are propagating to practice Brahmari, because nitric oxide will prevent the entry of the pathogens, preferably virus. In COVID-like condition, Brahmari is well advised. So here research says that Brahmari pranayama, that is humming sound, what we say, humming sound will give the vibrations to the all the sinuses, and even it will give the vibration to the cranium. So it not only helps to take out the culprits from the sinuses, but even it will give the massaging effect to the brain, which will helps to tackle the stress like conditions. Once stress is controlled, even it will indirectly affect the improvement of the respiratory health. So here one thing I want to say, Brahmari pranayama, usually in classical they mentioned that Vegat Gosham Purakam, Vegat Gosham, Brunganadam, Brunginadam, Rechet, Mandam, Andam, Mandam, Mandam. That is Brunganada and Brunginada. So you should inhale, and while exhaling, you should produce the humming sound. You should produce the Brunganada. Brunginada is nothing but sound similar to that of the male and female honeybee. So Vegat Gosham Purakam, Brunganadam, Brunginadam, Rechet, Mandam, Mandam. So here when you produce the Brunginada, that is when you produce the humming sound, that humming sound will give the vibrations that will helps to cleanse your sinuses. So this is one of the recent study which is done on the COVID-19 infection. They says that this will helps to enhance the release of nitric oxide. As I stated, nitric oxide preferably here research says that 15 usually nitric oxide are released from each and every cell of our body, but when you practice Brahmari pranayama, 15-fold of nitric oxide level is increased. Just assume what will be the advantage of practicing the Brahmari pranayama. So one alteration I would like to say here, one of the research here in a previous study, so how they practice is that inhaling while exhaling produce the humming sound, and some people even adopt the Shanmukhi mudra. But one of the modulation done in this study is that inhale while exhaling, you need to touch the tip of tongue to the palate. You should touch the tip of tongue to the palate, then blow your cheeks. Then after blowing, you should try to produce the humming sound. The rationale they had given why to touch the tongue to the tip of the tongue to the palate. They said that vibrations which are created in the throat that are easily taken to the cranium, because there is no any bridge between. Because of that, most of the vibration they stay in the throat area itself. So we need to take the vibrations to the cranium. That is only possible when we build the bridge. Here the tip of tongue is going to act as a bridge which takes the vibration to the cranium, and when the vibration flows to the all the sinus and your nasal tract and in brain, it has more beneficial effect. This is the one of the alteration what they incorporated in this study. So usually Brahmari pranayama, inhale while exhaling produce the humming sound. So in such a way you need to practice. And another one is Pranava Pranayama. So this is also very important part, especially in COVID, post-COVID management. They are propagating to practice the sectional breathing. Sectional breathing is nothing but the Pranava Pranayama. What is Pranava here? That is pronouncing or chanting the Akara, Ukara, Makara. When the person chant Akara will helps to vibrate or activate the lower lobe. Ukara will help to activate the middle lobe of the lung, and Makara will help to activate the upper lobe and even all the cranium. So Pranava Pranayama, if you practice in your day-to-day life, that will also help to enhance the respiratory health. How to practice? Inhale while exhaling, you should produce the Akara. Soon after chanting, you should try to feel the vibrations. Then again inhale while exhaling, chant the Ukara. next makara, and even you can experience that. You just chant the akara, then you just place the hand over the lower part of the lungs, then you will find lots of vibrations here. When you practice ukara, place the hand over the middle part of the chest, you can feel the vibrations. When you chant the makara, you feel excessive vibration in the upper part of the lobe, that lungs, that is in the apical. So here itself pranayama helps to activate all the lobes. Again, Omkara chanting, again, there are numerous studies saying that how exactly Omkara chanting also helps to release the nitric oxide and even relax your mind to tackle the stress-like condition. And Chandra Anuloma Viloma Pranayama modifies cardiorespiratory function. Why placed this one last? Because see here, there is no any classical reference for Chandra Anuloma Viloma or Chandra Vedana. So only we have Shitali, Shitakari, Sadanta Shitali. But Chandra Anuloma Viloma, it's not there. It is just contrast to the Surya Anuloma Viloma or Surya Bhedana. So here even Chandra Anuloma Viloma, they are practicing, that is left nostril breathing, closing the right, inhale and exhaling from the right. That will helps to enhance the cardiorespiratory functions. And last but not the least, you know that when the movie Bombay was released in 90s, especially Hamma Hamma song got viral. It was the talk of the town at that time. But same, when it was recreated by the same musician in the 2019, then that was not able to make such a huge name and fame. But humming sound of Brahmari is Anadi and Anantya. Always adopt to practice Brahmari. That will helps to keep your respiratory system healthy and fit. And see, in the morning also, Manjunath sir was saying that even we came across some of the data which says that even yoga has its own disadvantage. Instead of saying that yoga has disadvantage, you should be more vigilant enough to know the limitations. If you exceed, if you do anything beyond the limitation, then obviously you will fall sick. So everything, every act has plus and minus. So if you are vigilant, then you will be beneficial, or else you will be the sufferer. And last but not the least, so whenever you are practicing any kind of asanas, and according to the activation area, you can choose which kind of asanas or pranayamas. So again, as I stated, limitation is very much essential. You need to find out the limitation, which is the highest limit up to what extent we can do. If you know this limitation, then appropriately you can take the advantage of yoga and asana. And always try to practice in front of some experts, take the directions from them, then you practice. And one more thing which I could not highlight here because of time constraint, mudras, because we know that mudra is also very much essential. Nowadays, many people are circulating certain mudras, especially Udana Mudra. This is Udana Mudra, which will help to enhance the lung capacity. Sure, it will, because there are lots of acupressure theories saying that how exactly these tip of the fingers are going to enhance the lung capacity. Especially, they says that when they are indirectly affecting on the chemoreceptors, not exactly on the structure receptors, because mudras, preferably broadly, they can be classified into hasta mudras, or we can consider as the tattva mudras. That is thumb is like Agni, Vayu, middle is Akasha, and ring finger is Prithvi, and little finger is Jala. So if you want to maintain the normalcy of respiratory system, we need to control the Vayu Tattva. So if you just touch the thumb to the tip of the ring finger, tip of the Tarjani, then this is called as Jnana Mudra, what we say, Jnana Mudra. So that will help to maintain the normalcy. In the same way, if the person is suffering with, if the person is Kafaja Prakriti, if the person is suffering from repeated Kafaja Vyadhis like Kasa Shwasa, then he need to control the Prithvi and Jala Mahabhuta. So for that, he need to adopt the Surya Mudra. Surya Mudra is nothing but the just placing the thumb over the ring finger. This is this just joining the tip is called as Prithvi Mudra. If you press the ring finger, then that is called as Surya Mudra. That will helps to prevent or decrease the excess accumulation of the kapha. And even Jala and kapha are interrelated. Even you can go for practicing the Varuna Mudra. Varuna Mudra is just touching the ring finger. So little finger tip with the thumb. This is called as Varuna Mudra. And if there is excessive fat or excessive fluid accumulation, like what we call accumulation in thoracic or pleural cavity, then he can go for practicing the Jalodhara Nashaka Mudra, that is pressing the ring finger. So this is best for maintaining the respiratory health, like decreasing the kapha and Jala Tattva. And this is to maintain the Jala Jala Panchamahabhuta. And if you want to maintain the Prithvi, you need to touch, that is Prithvi Mudra. Or if you want to decrease kapha, then you need to press the ring finger. This is called as Surya Mudra. And this is called as Udhana Mudra, which even helps to increase the respiratory function. So while practicing pranayama, if you incorporate the concept of mudra and even Shathkarmas, that will helps to maintain your whole respiratory system. Last but not the least, as I stated, you can do whatever you want, but if your body accepts it, then you can achieve many things. So this is the Adho Mukha Vrikshasana, which will helps to activate the apical lobe. If your health permits to practice this one, you can practice and you can attain all the things. So this is my submission. Thank you, organizer, for this beautiful opportunity. I would like to thank Principal Sir Sarveshkar Sir for this opportunity, and the preferably HOD of the department, Sudhakar Reddy Sir, for this noble opportunity. Thank you, one and all.
Thank you, Dr. Kashinath, for your elaborate session. Even though you are busy with the OPD today, I understood. Okay. But anyway, thank you very much.
Yes, sir. My pleasure. Thank you, sir.
Presentation. Thank you.
Thank you, sir. Thank you. Any questions, or just we need to wind up now? I need to wind up. Sorry.
Sir, we are running short of time.
No issues. Thank you once again, organizer of the institute, for this opportunity. Thank you.
Thank you, sir, for all your great presentation with videos, photographic presentation with practical applicability. You even divided yogasana for lobes of, which can activate lower lobe, apical lobe, and all that. It was very much practical, sir. Thank you. Thanks a lot for sharing your expertise and time with us. Thank you, sir. We'll move on to session 2 in this afternoon hour, wherein we have Dr. Dilip Kumar sir. To introduce Dr. Dilip Kumar sir, I'd like to request Dr. Sushmita, second year PG scholar, to do the honors. Dr. Sushmita.
Yes, sir. Thank you, sir. Namaste. Pranams to His Holiness Sri Sivaratri Deshikendra Mahaswamiji and respected dignitaries and all participants. I will take this opportunity to introduce Dr. K.V. Dilip Kumar for today's session. Dr. K.V. Dilip Kumar, formerly Professor and HOD, VPSV, Ayurveda College, Kottakkal. Sir has completed BAMS from University of Calicut and MD from Bangalore University. Sir worked as the Faculty of Ayurveda, University of Calicut, Kerala, Professor of Ayurveda, Institute of Oriental Medicine, People's Friendship, University of Russia, Moscow, Director, Clinical Research Institute for Yoga and Ayurveda, Kottakkal, and sir developed Ayurveda psychotherapy for technique Smriti meditation. I request sir to take over the session. Thank you.
Thank you. That nice introduction. Thank you very much. Am I audible?
Audible, sir. You are audible.
Okay. And very good afternoon to all. And at the outset, I would like to thank Principal JSS Ayurveda College and Dr. Sudhakar Reddy for inviting me and giving me an opportunity to meet you all and join this session. And welcome to all the participants. After having a very vibrant presentation from Dr. Kashinath, and today's after that wonderful sessions of today's morning session. So now I would like to share some of my experience and observations about how to treat psychosomatic diseases in Ayurveda. So may I share my screen?
Yes, sir. It is visible, sir.
Okay, thank you. Okay, so it is not enlarging. I think. Okay. Okay.
You can also press F5, sir.
Pardon?
F5.
Yes, yes. Okay, thank you. So
Yes.
in this presentation, I would like to introduce a technique called Smriti meditation. It is a Ayurvedic psychotherapy technique which we developed in Kottakkal Ayurveda College. So for the last maybe 20-25 years, we were having an institute called Clinical Research Yoga, Research Institute for Yoga and Ayurveda. In that, we have conducted a number of yoga therapy camps, and people were admitted and treated in combination with the Ayurvedic principles and yoga principles together. So the Smriti meditation is an outcome of all these experience which we had. And I think we can make use of this technique as a Sattva treatment, a practical application of Sattva treatment. So we are doing it regularly in our college, and I have conducting some courses on this, and now we are trying to propagate this idea much more. So the Smriti meditation, first I would like to give two cases, and we will discuss how we are managing the psychosomatic disease with this Smriti meditation techniques. Then I will explain about the principles of the psychosomatic diseases, as well as how the Sattva treatment is being used for managing this psychosomatic diseases. So starting from the first case, this is a case report recently published in Journal of Complementary and Integrated Medicine. And in that, it is a case which is admitted in Kottakkal Ayurveda College Hospital. And and finally, it is diagnosed as psychogenic pseudomyasthenic ptosis. The patient is of 47-year-old female, and she presented with a drooping of both eyelids, inability to look at bright objects, and increased preoccupation with her appearance, difficulty to face strangers, and increased anger. So considering this, of course, while examining that aspects of neurological aspects and all is not found in this case, and muscular wasting also is not found in this case, but there are some psychological features were present along with this drooping of eyelids. So the patient is having this problem for the last 1.5 years, and the patient was almost not at all, not even opening the eyes, maybe 2 to 3 centimeters she could open the eyelids. That was the condition when she was presented here. And she was treated with a Panchakarma treatment with the Snehapana and Vamana, and also some Shamana treatments were given. And finally, since the psychological factors are involved, they have treated with the Smriti meditation also. And during the process of Smriti meditation, I will explain it a bit later about how the Smriti meditation is done. And as I mentioned, that it is a interactive psychotherapeutic technique. During these sessions, it has been revealed that this lady having had a depression when she was 20 years of age because of the death of her brother. And later, of course, she had some symptoms, but it is all improved and she was almost in a good condition. But 1.5 years back, another incident happened. Her son's marriage was fixed and she was expecting for the marriage ceremony and all. Then suddenly the news came that they decided to drop this alliance and marriage. So immediately it was that was a very shocking news for her, because of her brother also died when he was waiting for the marriage of at that time when she was 20 years of age. The same situation happened. So she understood that this is the reason, this fear of death of her son she was expecting because of the previous life trauma in her life. So after realizing this cause, she started crying continuously for hours together. But thereafter, she could open her eyes and it was perfect thereafter. In another case, this is the picture of that case before and after. In another case, an 61-year-old lady whom I did a meditation over Zoom, because she is living in Denmark and she is basically from Russia, and she got married 4 times and she has got one son, 41 years. The main problem she stated is that her ex-husband tried to kill her, and that was a big psychic trauma for her. And also later she got married to another person in Denmark, and this person also stolen her money and betrayed her. And she was expressed with a lot of stress and emotional pain, migraine and hypertension. And also very importantly, she has a Parkinson's disorder. And she is also suffering from insomnia. So I would like to show a video of the practice of this meditation, because maybe it will be helpful for you to understand how it is being done. So if I am recording, do you have any objection? Like if it is a recording, because I just want to. Okay, is it visible?
No, sir.
No. Okay.
The slide is visible.
Okay. 1 minute. I will just try to. Okay, if it is possible, I'll try to show it. Is it visible now?
Now visible, sir.
Okay.
They have Parkinson.
So if I am recording, do you have any objection? Like if it is a recording, because I just want to. Can you hear? Document it, like no. If you,
It's no problem. It's no problem.
okay, okay. So can you hear? That's why I'm just recording.
Can you hear?
Okay.
Doctor, and they just diagnosed Parkinson. But I think
So in
I
the
have it
procedure,
already
in the procedure of this
from
meditation is
December.
like that.
From
Initially,
December last
we
year,
ask
so it was,
some
no, it was
the
last
details
year.
and the
1.5 year.
case in
About
detail,
1.5 year.
and then we will fix a
It
goal
starts
for
slowly and just
the meditation.
more and more.
And that goal will be elaborated by having a discussion. And it is called a jnana process.
Do you have any problem with your sleep? Okay. And once you sleep, you have a good deep sleep. No, you don't wake up in between.
Yes, I wake up in between many times. Sometimes I sleep whole night, close to whole night. But sometimes I wake up all the time.
Okay. So you wake up, just go to toilet or just...
No, just look at the watch and turn around and sleep again.
Okay. Now you can just close your eyes and formulate in your mind a goal for today's session. So if you can make a question by yourself that what changes you wish so that you can feel more happy, comfortable and healthy. What changes you wish within you so that you can feel more happy. So thereafter we have lack of freedom and ask details of this problem. This all started when you are 31 years of age, no? When you are in Russia. Is it not? Okay. Then we give some induction techniques like ask the person to visualize a situation. Long road. Road, a highway. You are standing on a highway. Highway road.
Yeah, road. Yeah.
But you are on the middle of this road, and you have already passed a long way, and now you have to go forward. Just so then take her to more deeper states of consciousness.
You can see it on camera, but I can feel very, very bright light right now.
But during these stages, we will be interacting with the patient. Okay, look at that light. Look at that light. And as you're looking at that light, feel what kind of emotion you have. Emotionally, how you feel when you're looking at that light. Deeply feel. So usually this will take 1 to 1.5 hours, the entire process. As you are enjoying the peace and calmness in the hands, just feel that which part of your head. So after that, in general, since we started our meeting, and what are the changes you noticed? How it benefited you since our meeting?
What changes? But I have much huge change in my mood, because my mood start be much better. I have no depression, and I can see light. Light that is something happened all the time to better.
Okay.
And I start moving better and go better and keep balance much better and not shaking so much, not so much tremor.
Very good, very good.
So everything just go fine.
And okay, so okay, let's come back to slides, I think. Okay, this is the case of this lady. Actually, what happened to her is that when she was a little child, she didn't get much attention from her father because she lived in Russia, and there her father was a top leader in the Communist Party at that time. That was during this Soviet period. And so she was lacking this attention of the father. So when she grown up, she was looking for the love from a father figure. So she was always easily get attracted to men who is showing some affection to her. And she got married, but every time she got married, she was betrayed, or she was cruelly punished or tortured. And that is why she told that when she was 31-year-old, one husband tried to kill her and another time she was brutally cheated by another husband. So this is the reason why she developed her Parkinsonism. And before that, she had migraine, and also she developed this insomnia, and all these stress conditions all happened because of this, from this relationship. So after this, during this meditation, she got deep into the memories, and she was even observed what happened in her childhood, and she could identify their emotions as a child and how she was unconsciously being attracted to the men. And once she realized that she could change her attitude, and she was feeling better and better. So in Smriti meditation, usually this is happening, that we are trying to help the person to get into a deeper state of consciousness, to understand a lot of childhood traumas, which they all collected from the childhood or in later period also. So this is very important. So why this Smriti meditation is different from the other type of meditation is that in Smriti meditation, what we are trying to do is that we are trying to remove the blocks or help the person to pass through the hurdles, internal hurdles, which we always experience while we are start doing meditation. So I'm sure that most of you might have experienced when you are trying to do a meditation, closing your eyes and sitting quiet, immediately you will be having a tendency to distract your mind, and you may not be able to stay in that state of meditation for a long time. The reason is very simple, that we all have a lot of negative emotion inside. These negative emotions we just want to avoid. And these unpleasant feelings we don't want to experience. That's why we try to distract this mind. But whereas in Smriti meditation, we can continue with an interaction, and whenever these obstacles are developing and the pain or discomfort is experiencing, the guide will be able to help the person to pass through this emotional state. And once the person is reaching in a level of meditation, then they can continue to do meditation without any distractions. So because of this possibility, almost everybody can make meditation very deeply. Even if it is a patient, is physically or emotionally sick condition also, the person will be able to do meditation. But while going through this emotional state, of course, sometimes they may be feeling some unpleasant emotions or sensation, physical sensation. But after that, they will get transcend to these emotions and sensation, and these emotions and sensations easily subside. They will feel more happy and healthy. That is the advantage of this meditation. Okay, let us come to details of this theory which we are following as a for developing this meditation technique. So we all know that the symptoms are just a tip of the iceberg. So when we get into any kind of a disease deep inside, you can see a story behind this disease. So it might have started from long back, maybe from childhood or some other time, some life events, some trauma. That might be the background for this development of the present symptom. So, or when we have more accumulated symptoms repeatedly, when we have some repeated traumas, then a last drop, a simple event in the recent time can provoke all these memories, and that will develop as some manifestation of a disease in the form of physically, somatically, or psychosomatically. And when we think about the management, we know that Ayurveda and yoga has got a holistic approach on health and disease. And of course, Ayurveda is giving more emphasis on the physical aspect of the disease, whereas yoga gives more emphasis on the psychological component of the disease. So we need to combine these two. And Ayurveda has also very much accepted yogic principles as the treatment for psychic disorders. Yogo moshe sarvasam vedananam avartanam. So when we look at the human being, both Ayurveda and yoga has got a holistic perspective. In yoga, it is 5 koshas, Panchakosha principles are mentioned to explain the different subtlety of the human existence. Same as in Ayurveda, we have Sharira, Indriya, Sattva, Atma. And when we look at even the different aspects of Sharira also, it is starting from the gross level to the subtle level. Like, Mala is the grossest, then Dhadu, then comes Kapha, Pitta, Vada, and then Indriya. Indriya is more or less similar to that of Pranayama kosha also. Like, then comes Manas. Manas has got the subtlety. So it is like from the gross to the most subtle. The same is in Ayurveda, yoga also, from Annamaya kosha to the Pranamaya kosha. So whenever disease is manifesting, we should try to understand in which level or which kosha this disease is influencing. Accordingly, we have to have a plan for treatment. So the Ayurveda accepts etiological factor Nidana as like a web of causation. There are multiple factors: Kala, Artha, Karmana, Hina, Mityadi Yoga, and Prajnaparada. All these are the causative factors for the diseases. So all these factors are interconnected. And like age, food, and sleep, and place, and everything is causing that. But they are all interconnected. And but when we look into the more deeper into that, we can understand the psychological factors are more significant compared to all other factors. And ojas, then comes ojas, and then comes dosha. These are all the main factors for preventing the disease, as well as the in their deterioration leads to disease easily. That's why dosha is called a dosha. When we look at our Z category security, like we have a kind of a layered security. So whenever there is a emotional problem occurs in the mind, then and there itself there is a security measure. There the sattva is the security measure, because when sattva is elevated, then there is no mental problem, because we all know that the mental problems are occurring because of the rajas and tamas. So psychological disease is leading to other psychosomatic disease only when sattva is deteriorated. Then when there is a weak sattva, or then the person is having a hina sattva, then that will cause further percolation of this problem into other layers of security. But if a person is having a sattva bela, proper sattva bela, any psychic trauma will not cause cause a disease in the body later. But if the sattva is weaker, then it percolates, and then first, the next level, we have ojas to prevent. And ojas is also maybe deteriorated if the emotional factors are deteriorated. Ojat shiyede kobat shuddhyana sramadibhi. Like, no? So that's why emotions, and not only this emotions, then Shutta, Dhyana, Srama, all this can affect the ojas also. And if ojas is also weakened, then only the disease factors percolate further deeper. And there, of course, dosha can prevent the dhadus from affecting from the disease. Dosha samya marogada. But this dosha samya is also lost, then disease will further percolate and affect the dhadus, and disease can get affected and manifested as a somatic disease later. And we all know that the importance of Prajnaparada. Even other factors, Prajnaparada is more important than the Kala, Artha, Karma, Hina, Mityadi, that factors. Like, why? Because of that, when we have a proper intelligence, we can prevent many diseases. Because from the very childhood, we are getting a lot of information, correct information to be a healthy person. many hygienic measures or behavioral patterns to formulate to be a healthy human being. All this sadachara we are learning from the childhood is very important. If we keep remembering it, and if we have this proper understanding of this proper directions of these sadacharas and all, we can prevent a lot of psychological problems in future. And then comes dhridibhramsha. Dhridibhramsha is the lack of willpower. There are certain situations where we know that what is the problem or what is to be followed, what is healthy practice, but unfortunately we cannot do it because of that the desire or passion or addictions. So people can take alcohol not because of that they don't know the consequence. It is written there. Smoking, drugs, everything they are using, even though they are aware that it can cause harm for them. So here actually they are lacking the willpower. And then memory. The memory is very important for all the learning process, because we are adding each and every information to the previous one, or we are updating the previous one when we are having a better or a correct knowledge. So, but if the memory is lost, or memory is a disturbed memory or improper memory, that can lead to many diseases. As in the case of these two patients, they were having a disturbed memory or a deteriorated memory about their childhood experience. So they were easily reacting to any current stimuli which they are getting from the present life, and it will cause a lot of negative emotions because of this past traumatic experience. So when you look at psychological disorders, the diseases are mainly causing because of that negative emotions. We have basically 4 emotions, that is happiness, sadness, fear, and anger. And of course, happiness is the very basic nature of our soul. And but all the other 3 are from our from the Prakriti. When there is a Atma and Prakriti combination is there, soul has got this happiness, but the Prakriti is having all the negative emotions. And these negative emotions we are eliminating by proper knowledge and or expansion of more sattvic features. But if that is not happening, then these negative emotions get accumulated in the form of many different permutations and combinations. We can have not only just anger, fear, and sadness, it can be in the form of annoyance, contempt, disgust, or it can be like anxiety, panic, depression. All these different forms of diseases are causing because of accumulation or development of more negative emotions within us. So in fact, we call in Ayurveda manovikaras. Vikaras means they are diseases. When these negative emotions are more getting accumulated, or definitely that will be leading to the psychological disorders. And these psychological disorders can later be transferred to the body. That somatization process is happening. The transfer of emotion to the body, of course, initially it is needed for quick response. When we have a fear, we need to transfer our fear to the body. Then only we will be able to have a fight or flight action. And but sometimes it will be more repeatedly happening, and the body get disturbed very significantly. And also transferring these negative emotions in the body helps the body to cope up with the new challenges easily. So we can develop some skills. For example, learning cycling or driving. All these things are or when we are falling, how to protect us from not falling. So all these things are our skill training. And emotions can store life experience into kinesthetics memory. So memory is not just stored in our brain, but it is also stored in our body tissues also. because then only we will be able to respond whenever there is a quick necessity for reactions. And the stress level can be reduced temporarily. So if we have so much stress, it will be better to have a headache or a back pain rather than always having a disturbed mind and not even able to sleep. So that is also the stress as situation. The body emotions are transferred to the bodily sensations, helps to modify the emotional expression to the socially appreciable behavior. When we have some emotions, instead of shouting very loudly, we can just tighten our fist. That is a acceptable behavior, like no. So, and de-somatization and re-somatization. As child grows up, the change verbal communication is an example for that. So like that, we have many situations we try to somatize our emotions. But this somatization of emotion, as we know that how it is happening, there is a physiologically when we are thinking that when there is a negative emotion is there, then amygdala is triggered, then amygdala can cause the hypothalamus pituitary adrenal axis stimulated. That will leads to many neuroimmunological reactions, and that will cause the increased activities of all our internal organs as well as the musculoskeletal system. And of course, after that the stressful situation or emergency situation, it will subside because of the parasympathetic dominance. But this is not always happening. Sometimes when we have some repeated stress and emotions, then these constant changes are happening in the body, and this constant somatization leads to a permanent changes in the body, and that will lead to a disease. So that is the pathogenesis of psychosomatic disease. So therefore, whenever a patient comes to us, whether the patient is an asthma patient or a diabetic or a irritable bowel syndrome patient, whatever it may be, we have to assess that on which level the patient is having a more dominated disease, whether it is at psychic level or psychosomatic level or somatic level. Or we can think about, is it Annamaya Gosha or in Pranamaya Gosha or in Manomaya Gosha or in Vijnanamaya Gosha, or in we have to think about it, whether it is in Sharira or in Indriya or in Manas or in Atma. So until and unless we understand, try to understand the disease from this gross to subtle level, we will be missing many diseases, because all the investigations will not give the correct assessment of the disease condition. That is what in modern medicine they are failing, because they are just try to scan all the patients and to identify the diseases are there. But many times diseases are not like that, because you know that asthma episodes, when it is exacerbation is there, it is manifesting in the body. But once it is subsided, you will not find any symptoms at all. So like that, many diseases are which is appearing and disappearing. When they are disappearing, they are not in the somatic level. So without understanding, it will be difficult to treat the disease. And these emotions, when you closely observe, we can understand many of the bodily sensations, bodily symptoms are the just manifestation of it is like a transfer of these negative emotions into the bodily sensations. For example, if a patient is having the sadness, and he may develop a chest pain or a body pain, nasal blockage, dyspnea, and majority of the people who is having upper respiratory diseases, if you trace that reason, they may that may end up with some sadness or depression. So same like if a person is having a increased anger, that will expressed as a skin rash or burning sensation or itching, increased body temperature. Like fear can cause irritable bowel syndromes, gas formation, coldness of the body, dyspnea and palpitation. Guilt, you might have observed that people feel difficulty in the throat. They find a bolus in the throat when they're having this guilt feeling. Same as offense. If a person is feeling offense also, it is affected, they will experience a discomfort in the throat. And these diseases, if it is in chronic stage, if it is repeatedly happening, it can cause thyroid dysfunction or sore throat, or it can cause a thyroid cancer like conditions like hopelessness, can cause the tiredness of the body, heaviness of the body, and indecisiveness. If the person is having long-term indecisiveness, then that will lead to headache, insomnia, or migraine. And stress at work, repeated stress can also cause the headache, insomnia, neck pain, lower back pain. And lower back pain, usually we often attribute it to the physical strain. But when we closely observe that without having a emotional stress, it will not occur most often. If a person is having a constant physical responsibility, it's not that strain. If a housewife morning till evening she's engaged in some activities, mild, maybe it is a silly works at home, but when she is totally engaged in this work, she can easily develop a back pain. Whereas a person who is having too much of responsibility at his job or her job, that can lead to a cervical spondylitis, because as we used to say that I'm shouldering the responsibility. So this initially it can be just a spasmodic changes there, but later it can cause, when repeatedly it is happening, it will lead to intervertebral disc prolapse, or diseases can like a headache very frequently occurring. It can lead to even brain tumor or hypertension. So many diseases are converting from a psychological level to somatic level. So Ayurveda really recognizes this. That's why from the very beginning, it is Ragadi Rogan. Ayurveda clearly mentioned that the significance of understanding the psychological factors in disease. So the treatment is divided into three, like Devapasraya treatment, Yuktivapasraya, and Sattvapaja treatment. I would like to say that Devapasraya treatment often we consider it as a psychotherapy in Ayurveda, but not, because this Yuktivapasraya and the Devapasraya is meant for Sharirika doshas. And Sattvapaja treatment is meant for Manodoshas. Manaso, Jnana, Vijnana, Dhairya, Smriti, Samadhi. Prasamyat, Aushadai, Purve, Deva Yuktivapasraya. So the Devapasraya treatment is also for Sharirika doshas. Maybe it is because of that it is all a ritualistic practice which has been continued, the ritualistic practice which we could find in Vedic Purvakanda of the Vedas, may be carried over to our classics. That's why this Devapasraya treatment came into existence. Whereas when it comes to Manodoshas, it is very clear that we need to follow these five components: Jnana, Vijnana, Dhairya, Smriti, and Samadhi. So if we can look into these practices, we can clearly understand it is nothing but the essence of yoga is included in this Devapasraya treatment very well. All this jnana, if you are keenly assess that, see, it is mentioned that Vidya, Siddhir, Madhi, Meda, Prajna, Jnanam, Chasamada. Vidya is the information. As I told in Buddhi Vibramsha, when there is a lack of knowledge or incorrect knowledge and or improperly understood knowledge is there, then that will lead to many behavioral problems or improper activities. So there the treatment is to provide proper knowledge, proper vidya. Here also in COVID-19, what we need to do, we need to provide proper knowledge, because health awareness is more important. That's why in preventive medicine, the health awareness program has given much importance. Because when there is a lack of knowledge, that will lead to psychological disorders as well as somatic disease also. So that is what Vidya. Siddhi is the acquiring skill. So when we are training people to be skillful in relaxing their body or addressing some fearful situations. So many training skills are needed for us to be more bold and confident. When children is not properly trained, they will not be able to climb in the escalator. They will not be able to climb in the travel by flight. So everything is skill is also needed. That is what Siddhi is mentioned. And Madhi is really the non-directive counseling technique in Ayurveda. So we need to look at the psychological problem from the different perspective. By interacting in a debate manner, we have to address and we have to come to some proper conclusion. So that we can do by asking the questions from different levels. The patient will have a realization by themselves. In Medha is a kind of a sacrificing of false belief. Many of the people who is having these psychological problems, they carry kind of a misbelief, a core belief, and it might have taken from their childhood, and or some learned person has influenced them. So that kind of a misbelief, it can be from the religion, or it can be from the family. So that may lead to many psychological problems, and that is to be cleared. And prajna is the doubtless sattvic knowledge we need. So by providing these 5 knowledge, we can treat many psychological events. So initially, that's why in this Prati meditation, what we are doing, that we are just having an interaction with the persons to have a expanded awareness of all these problems from a logical point of view. So we just discuss from different perspective. So the person themselves will get realized that, oh, that is my problem. Like, no, it is a intellectual, a logical exercise. And when it comes to Vijnana, because Vijnana indicates that we need to have this understanding of who am I, identifying the goal of life. This is very important. In Ayurveda, it's very clearly mentioned that dharma, artha, kama, mokshanam, arogyam, moolam, uttamam. So we are all have to attain the moksha. That is the final goal. And but of course, everybody is not aware that I'm going to this moksha goal. But they should know that they are every time they are clearing their obstacles, which is preventing them to move higher levels of personality. So that's why the identifying the goal of life is very important. And during the process of meditation, we make them to be aware of their goal for the life. And each emotional problems is nothing but the obstacle or hurdles which they are experiencing in their journey towards the final goal. So by doing a meditation, they will realize this obstacle, and that will be removed. Then in the next meditation, again, we are fixing a improvised goal. So like that, the personality of the person will be gradually improving, and they will be moving towards the most much more comfortable state of life. Dhairya here means the willpower to control our temptations or passions. Like, no, it is not an easy. If we are asking a diabetic patient not to eat sugar, okay, it is easy to tell them, but they don't know how not to eat. Or if you are telling to an alcohol addict not to take the alcohol, it is easy to tell, but we are not teaching them how not to drink the alcohol. So actually there is a solution. Ahidebhyo ardhebhyo manonigraha. That is what Ayurveda teaches us, and the Sattva is meant for that. So we need to practice various yogic techniques like asana, pranayama, pratyahara. They're all nothing but expansion of awareness of our behavior. You observe that in yoga, it is very clearly mentioned that prayatna shaidilya ananda samabadipya. So effortless and ananda samabadipya, expanded awareness. Each and every yogic practice, whether it is Arthakadi Chakrasana, Padahastasana, or or Nadishuddhi Pranayama or Kumbhaka, any kind of practice, it is to be done with the utmost awareness. Awareness is the key word in yoga. When we have a expanded awareness, we can observe what mistakes we are happening in our behavior. So, and when a person is get addicted to some misbehavior, there must be an underlying emotional part is there. But when we could prolong or stretch this behavior, making a slow motion, that person will be able to identify that the behavior hidden there. So in Smriti meditation, we are trying to give this all these yogic techniques when they have problems like phobia or OCD or some tics or dermatillomania, kind of behavioral problems are there. Then this kind of awareness-based meditation we are giving. And Smriti, the fourth component is Smriti. Charaka has clearly mentioned that the 8 methods, Nimitta, Rupa Grahana, Sadrisha, Viparya, Sattva Abhyasa, Jnana Yoga. So all these 8 components are the best tools to take a person to more subtler levels of consciousness or higher levels of consciousness. I'm not going to explain it due to the lack of time, but these all are the key points which Chara has given for us to induce a person into a higher state of consciousness to take them to the meditative stage. So based on these concepts, we have developed a Smriti meditation technique. In Smriti meditation, as I have explained, that it is a guided interactive meditation technique so that whenever the patient is encountering some obstacles during their journey to the higher state of consciousness, we can help them to elaborate or expand their awareness. And this expansion of awareness is a very beautiful tool for dissolving these obstacles, and they can move forward, and they will be able to remove their emotions, negative emotions, and finally they can come out with a more happier and healthier and confident. And the Smriti meditation the meditation term represent, it is also the part of the 5th component. Samadhi is also incorporated into that. So the Smriti and Samadhi, because Smriti is a unique method which is mentioned in Charaka, and in other yogic classics we cannot find this Smriti. Of course, Patanjali has mentioned about Smriti, but that is a different in a different context and different. But as a tool to enter into the deep psychological levels, I didn't find anywhere in the other classics, in yogi classics, such techniques are mentioned. That's why Smriti meditation, I would like to say that it is a purely Ayurvedic psychotherapeutic technique, and it is the best way to apply the Sattva treatment in our patients. So by using this technique, we can take the person from this Jagrat level initially to the Sapna level. So we ask the person to visualize or sensitize some body's sensations, or getting into the state of emotions. They will immediately transcend to the state of Sapna. So when they are moving towards that, here you can see that I have given a ratio between the soul and mind. The involvement of the mind reduces, and the soul, the conscious activity, in the conscious activities, the proportion of the soul and mind, the soul will be increasing in the Sapna state. And even when further deepening into the state of meditation, they will reach the state of Sushupti. There will be more predominant soul, but mental activities are reducing. And finally, when they reach the state of Turiya, there is a minimal mental activities. That is why Yoga Chitta Vritti Nirodha. So when we achieve that state of higher state of consciousness, very minimal or maybe absolutely state of absence of mind will be there. Then we can have a lot of realizations and revelations. And many of our problems which we set as a goal will be cured, we will easily find an answer. And this answer will be appeared as a revelation for us. That is the beauty of this practice. And Patanjali has given ample suggestion for such practices. So, Vishayavadiva pravartirutpanna manasastiti nibandhani. So, we can meditate on sensory objects, helps to stabilize the mind. And also, Patanjali has given another indication that Vishogava Jyotishmadi. We can meditate on our emotions. It's not that we always have an impression that either we need to meditate on Om or some God's figure. Not like that. So he has given like that. No. Vidaraga Vishayam va Chittasya. So meditating on desire, you can meditate on your intensive desire for your love. But at the end of that meditation, you will realize that what is that reason for that you have this uncontrollable emotion or attachment to that, and you can get rid of from that. Like Swapna Nidra Jnana Lambanama, even meditating on the dream is also mentioned, because meditation, dream is also a process of meditation in which we are trying to solve our problems subconsciously. So that we can be created, and in such a dream stage, we will finally come up with a solution. So Yadha Abhimada Dhyar. So we can choose any interesting object for meditation. So the samadhi is not that, as we all know that it is, there are different layers in samadhi. So if you keep a goal for meditation and getting into the state of meditation, and if you can just touch a fraction of a second in the Turiya state, you can get a new revelation. I consider that is a samadhi, but that may be a savidarka samadhi. So like if you can keep on repeatedly practicing this meditation, you will be able to move for further higher and higher state of samadhis. And then you will be able to stay longer in the samadhi state. But initially you need to clear off all these negative emotions. Then really you will be able to develop in this samadhi state. So when it comes to the treatment, if the person is having a disease at psychic phase or at Jnanamaya Kosha, then we have to provide, we have to treat for ignorance and misunderstanding and conflicts. And for that, Jnana, Vijnana and Smriti meditation techniques can be used. If it is an emotional level, then this Jnana, Vijnana may not be very much effective. Then the person will be feeling fear, sadness, and anger. In that, Smriti meditation will help them to get into their memory and to identify these negative emotions, and that can be cleared. And in psychosomatic phase, where the person is experiencing pain, dizziness, nausea, tremor, dyspnea, cough, and sneezing, weakness, and all, there the dhairya practice along with the Smriti meditation is needed, with a lifestyle modification, massage, fasting modification, diet modification, yoga therapy, mild medications, all suggested. But in somatic stage, then it will cause degeneration, growth blocks, and fluid retention, rupture, emaciation. Such things are happening. Then Smriti meditation has got no role in that. Whereas dhairya and other treatment like panchakarma meditation, surgical. So we have to have this judicious combination of yogic and Ayurvedic technique. Then only we will be able to deal the disease in a holistic manner. So it is very important that our body, how our cells are reacting. We are having trillions of cells in our body, and they are having their own lifespan. Some cells live for 2 months, some cells live for 20 days, some 140 days. And but they are all different cells, like blood cells or muscle cells and brain cells. Everything is working for us. So it is a collection of different trillions of cells, but there is somebody is there which is controlling them together or coordinating them. So who is that? That is none other than our soul. So, but if the soul is not in its own position, then the cells will be fighting each other. That will be causing diseases. And but once the soul is in its own position, then everything will be in order. All the cells will be functioning very cordially, and that ensures health and happiness to us. So that's why the term sosta, represents the soul, sta, in its own place. So the health is nothing but soul is in its own place. And so we have published some few, research papers also. And we are now trying to develop some evidence based on this, and especially during the meditation, we understood that by providing this meditation technique, we can bring the person into a more theta dominant stages. Even if the person is not having so many experience in the meditation in the past, we can provide this theta dominant state, which is usually seen in the very experienced meditators. And also we can find many markers to identify different emotions during the meditations. We are using this Muse to identify these techniques, to develop some markers for emotions. Okay, to conclude, what I would like to say that Spurdi meditation can be an effective tool in identifying the cardinal reasons, because especially most of the diseases are psychosomatic in nature. So we need to understand what is the reason for this disease, and it can be helpful in clearing the emotional component of the disease so that the further somatization of the disease can be prevented, and has a therapeutic effect in curing many psychosomatic symptoms. And of course, we need to do it. We just started only, so we need to do a lot of research studies. Of course, in Kottakkal Ayurveda College now, 2 PG researches are undergoing, and I will request you, the students who are listening to this presentation, if they are interested to take up this study, and I hope that you will be able to contribute something to this area, because it is very important. This is high time for Ayurveda to have this holistic approach in the treatment. Otherwise, we will be lacking very big event. We will be losing the originality of Ayurveda. So with that words, I would like to conclude, and I thank once again for the organizers for giving me an opportunity. Thank you very much. Thank you.
Thank you, sir. Thank you for your experience, sharing all your experiences, even with videos. How do you do counseling, and with all the case presentations? I'm sure you have reached everyone who is listening the lecture. Thank you, sir. IB from Jssamc Medical College and Department of Psychotherapy, we wholeheartedly thank you for sharing your expertise and the whole technique in detail. Thank you, sir.
Thank you. Thank you very much.
With this, we come to the end of scientific sessions, and we will be beginning the valedictory function now. To begin with the valedictory, I would now request Dr. Pooja, Assistant Professor, Department of Psychotherapy, to welcome everyone to this valedictory program. Dr. Pooja, please.
Namaste. Good evening, everyone. Saluting to the lotus feet of His Holiness Sri Shivaratreshwara Deshikendra Mahaswamiji, Sri Kshetra Sutturu. Nasti maya samopasho, nasti yogat param balam. Nasti jnanat paro bandhuhu, na ahankarat paro ripuhu. There is no bondage equal to illusion. There is no strength bigger than yoga. There is no friend better than knowledge. There is no enemy worse than ego. In this present plight of global pandemic, where entire mankind has to put up with, yoga and Ayurveda are the distinguished rays of hope. On this occasion of 7th International Day of Yoga 2021, Department of PG Studies in Swasthavrita, JSS Ayurveda Medical College, Mysuru, has organized this international webinar with the theme Yoga for Unity and Well-Being. I'm Dr. Pooja Hassanji, Assistant Professor, Department of PG Studies in Swasthavrita, is here to welcome you all to the valedictory program. First of all, I'd like to welcome today's chief guest for the valedictory program, Dr. Vanita S. Shetty, Principal, Alvas College of Naturopathy and Yogic Science, Mudbidri, Dakshina Kannada. On behalf of institution, I wholeheartedly welcome you, madam. Next, I'd like to welcome our beloved principal, JSS Ayurveda Medical College, Mysuru, Dr. Sarveshwarkar, who has always been the great inspiration to us. I welcome you, sir, to the program. I would also like to welcome Dr. Rajesh A. Udupudi, Dean, JSS Ayurveda Medical College, Mysuru, who has always been our constant support. I wholeheartedly welcome you, sir. I would also like to welcome Dr. P. Sudhakar Reddy, Professor and HOD, Department of PG Studies in Swasthavrita, JSS Ayurveda Medical College, Mysuru, who is the foreman of this program. I welcome you, sir. I also like to welcome all the members of organizing committee, all our faculty members of different departments, our PG students, UG students, and all the participants of this program. Once again, I welcome everyone. Thank you.
Thank you, Dr. Pooja. On behalf of all present here, I also welcome you to this valedictory program. It's been a long day with 4 speakers speaking on different aspects of yoga and other related things, for which I welcome Dr. Soumya, Associate Professor, Department of Swasthavrita, to read out, to present the report of the webinar. Dr. Soumya, madam, please.
Good evening, all. My humble pranams to His Holiness Puja Jagadguru Sri Shivaratri Deshikendra Mahaswamiji, Shri Kshetra Sutturu. Since from the inception of International Day of Yoga 2015, Department of Swasthavrita, JSS Ayurveda Medical College was conducted various offline related events to yoga. Due to COVID-19 pandemic, the thought of celebration goes online. On the eve of 7th International Day of Yoga 2021, Department of PG Studies in Swasthavrita, JSS Ayurveda Medical College, Mysuru, planned to organize various events like 2 international webinars on yoga, online mudra competition, yoga protocol practice to all UG students, PG scholars, faculty members, as per the guidelines of International Day of Yoga 2021. Today, that is 29th May 2021, we had international webinar on yoga 2021 with the eminent resource persons in various scientific sessions. I am Dr. Soumya M.N., reader from the Department of PG Studies in Swasthavrita, here to brief today's international webinar on yoga 2021 with theme Yoga for Unity and Well-Being report. Webinar was inaugurated at 10 a.m. with prayer by Dr. Lavanya, internee, JSS Ayurveda Hospital, Mysuru. Dr. P. Sudhakar Reddy, Professor and Head, Department of PG Studies in Swasthavrita, welcomed the guests and participants to the webinar. Dr. Rajesh A. Udupudi, Dean, JSS Ayurveda Medical College, briefed the webinar to the participants. Dr. Deepa C. Patil, Professor, Department of Kaya Chikitsa, introduced the chief guest, Sri R. Mahesh, Director, Medical Division, JSS Mahavidyapita, to the participants. Sir spoke on importance of research in the field of yoga, that is, its benefits to the student as well as public was addressed. Guest of honor, Dr. Radhakrishna Ramarao, Principal, Government Nature Cure and Yoga Medical College, Mysuru, was introduced by Dr. Shalini S., Assistant Professor, Department of PG Studies in Swasthavrata. Sir opines the significance of yoga practice in maintenance of health and prevention of disease across the globe. Presidential address was carried out by our respected principal, Dr. Sarbeshwarkar. Vote of thanks was rendered by Dr. Aparna Surendra, senior physician from the Division of Yoga and Naturopathy, JSS Ayurveda Hospital, Mysuru. Scientific sessions of International Webinar on Yoga 2021 was started by 10:30 a.m. The first scientific session was taken by Dr. Arpan Bhatt, Professor and Head in GAM, Institute of Training and Research in Ayurveda, Jamnagar, spoke on the topic Yoga for Unity and Well-being. Second scientific session was started at 11:45 a.m. by Dr. Manjunath Sharma, Pro Vice Chancellor, Director of Research, SVIASA, Bengaluru, was introduced by Dr. Sushmita PM, Second PG Scholar, Department of PG Studies in Swasthavrata. Sir spoke on the topic Evidence-Based Research in Yogic Sciences. After delicious lunch at 2 p.m., third scientific session was started. The resource person, Dr. Kashina Samangandi, Associate Professor, NIA, Jaipur, was introduced by Dr. Madhusudan, Associate Professor from the Department of Roga Nidana. Sir spoke on the topic, Effect of Yoga on Respiratory System. Dr. Sushmita PM, Second PG Scholar, Department of Swasthavrata, introduced the fourth scientific session resource person, Dr. KV Dilip Kumar, Dean, Faculty of Ayurveda, People's Friendship University of Russia, Moscow, Russia, delivered speech on the topic Smriti Meditation Techniques. Valedictory Program of International Webinar on Yoga 2021 was started at 4:15 p.m. The chief guest for valedictory program was Dr. Vanita S. Shetty, Principal, Alvas College of Naturopathy and Yogic Sciences, Moodbidri, Dakshina Kannada. This is about the brief report on International Webinar on Yoga 2021. Thank you.
Thank you, Soumya madam. It's time we hear from the guest. Before that, I would now call upon Dr. Yashas, second year PG scholar from the Department of Swasthavrata, to introduce Dr. Vanita Shetty madam to everyone present here. Dr. Yashas, over to you.
Thank you, sir. Namaste. Pranams to His Holiness Jagadguru Sri Sri Shivaratri Deshikendra Mahaswamiji, respected Principal, Dean Sir, and all other faculty members. Now, Madam has completed Bachelor of Naturopathy and Yogic Sciences in the year 2000 from STM College of Naturopathy and Yogic Science, Ujire, Dakshina Kannada, from Kuvempu University, Mangalore. Madam also completed MS in Counseling and Psychotherapy in 2011 from Kuvempu University, Mangalore. Madam has worked as naturopathy physician at Chetana Hospital, Puttur from 2000 to 2004. From 2004 to till date, Madam is working as Principal and Chief Medical Officer at Alvas College of Naturopathy and Yogic Sciences and Hospital, Moodbidre. Madam was the first woman principal in the field of naturopathy and yoga in India. Madam was appointed as a member for Local Inspection Committee of Rajiv Gandhi University of Health Sciences, Bangalore from 2005 till now. Madam was member for Board of Studies, Naturopathy and Yoga in Rajiv Gandhi University of Health Sciences, Bengaluru. Madam was the member of National Board for Promotion and Development of Yoga and Naturopathy under Ministry of Ayush. Madam was Karnataka State Nodal Officer for National Naturopathy Day celebrations under Ministry of Ayush. Madam was also the member of Ayush Foundation, Mangalore. Madam was also speaker at Kannada Vaidyakiya Sahitya Sammelana organized by Rajiv Gandhi University of Health Sciences, Bengaluru. Madam was a keynote speaker in Jindal National Cure Nature Cure Institute, Bangalore. Madam was a resource person in various programs at Akashavani, Mangalore. Madam was also a resource person for Nammakudla JU Tunnel, Bangalore. Madam has created a health awareness through various talks among public. Madam was also a resource person for Ayush Talk in online webinars. Madam was a paper setter to MGR University in Tamil Nadu. Madam was also external examiner to S. Vyasa Yoga University, Mangalore. Madam is also a PG recognized guide of Rajiv Gandhi University of Health Sciences, Bengaluru. Madam was facilitated by Bunts Sangha, Puttur. Coming to the paper presentation, Madam has presented a research paper on effect on acupuncture and massage in tension headache. Madam has even presented a research paper on endocrine disorders and menstrual disorders in the field of yoga and naturopathy at different places like Bangalore, Manipur, Shirsi, and Mangalore. Madam has published a paper in International Journal of Current Research. Madam has also published a paper in International Journal of Medical and Health Research. Madam has also published a paper in International Journal of Research and Analytical Review. On the behalf of all faculties and students, I cordially invite Madam to do vote of thanks. Thank you.
Sorry, ma'am. Request you for the valedictory address.
Very good evening to one and all present over here. Respected Principal Dr. Sabreswarkar, Dean Dr. Rajesh Utkudi sir, and Professor and Head of the Department, Dr. Sudhakar Reddy, and all the students, my dear students, research scholars. It's my privilege to be a part of this program today, that is a webinar which is conducted, the yoga for unity and well-being. Since morning, we had eminent speakers in this panel, that is Dr. Arpan Bhatt, Dr. Manjunath Sharma, and Dr. Shashikant, as well as Dr. Kashinath, and just now we have finished Dr. K.V. Dilip Kumar. So once I congratulate all the speakers for enlightening sessions. At this outset, I congratulate JSS Ayurveda Medical College for conducting such an excellent webinar on the eve of 7th International Yoga Day. Yoga is an integral part of Indian tradition from time immemorial. So yoga is a word which comes from a Sanskrit word called yuj, which means to unite or to connect. So there are different terms, like different branches in yoga, which is Bhakti Yoga, Karma Yoga, Jnana Yoga, Kundalini Yoga, so on. Maharshi Patanjali, who gave about the Ashtanga Yogas, everybody, since all are from the department of Swasthavita and Yoga, all are aware about the Ashtanga Yoga. So Ashtanga Yoga, which tells about the 8 limbs of yoga, that is Yama, Niyama, Asana, Pranayama, Pratyahara, Dhyana, and Samadhi. So the goal of yoga is a far-reaching. It's not only a physical and mental health. It is to make understand a man to reach to a holistic, that is mainly to a spiritual, divine, and a blissful state. So when we say yoga, it mainly comes with, it speaks or it develops our personality. We say that yoga helps us in all the levels. It may be physical, mental, moral, spiritual, intellectual level. So today's topic of morning, Dr. Arpan Bhatt is very well spoke about unity and well-being. So when we say unity or the well-being, according to WHO, that is World Health Organization, The health is defined as not merely an absence of disease, but a state of well-being on physical, mental, moral, and spiritual aspects of being. So when we talk yoga, all these concepts are under, that is on the health. What WHO says, all we can see in the yoga. That is why now whole globe is looking for yoga. And when we say about the benefits, there was all the sessions of webinars were excellent sessions. And all of you have heard all these from morning 10 o'clock to till 4:45, the different benefits of yoga. So when we say a yoga, when we practice yoga, we can keep a physically fit. And on the mind and the emotions, which can be balanced. And on the intellectual level, it is where we can sharpen our intellect, which is required in this modern competitive world. But when we do yoga in a very involvement, because Sir said, like evidence, when Sjatkarmas sir was talking about evidence-based, he said there was a lot of involvement required. It's not that I practice, it becomes a fashion where I do yoga for 1 minute, for 10 minutes, 15 minutes, weekly, 5 days, all this. But yoga has to be performed in involvement with the dedication. Then definitely we can expect love, compassion, gratitude, and what we require is free from hatredness, jealousy, ego. So this is what we call it as a real essence of yoga. So when we say about this yoga has evolved in all the levels. Now when we talk about therapy, because we say therapy, so just now he has said that we have to go yoga for a holistic approach. So when we take a therapy part in this lifestyle, mainly in the modern era, we are facing a lot of lifestyle disorders. So yoga helps to cope up with the lifestyle disorders. It may be hypertension, diabetes, when it is approached, or when we are targeting in the initial stages of the diabetes, because all these are lifestyle disorders, even cardiac disorders. Because why we insist for all this is being yoga, we call it as a stress is the main cause for all the diseases. So when we talk about evidence-based, so beautifully explained by Manjunath sir, he said how meditation helps about 80%, how yoga helps, how pranayama helps. We think that practicing 1 hour or half an hour, it helps to cure disease. Of course it helps, but when it is done with the dedication, involvement for a longer period of time is required when we practice yoga. So on the evidence, there are a lot of evidence in yoga, so which motivates everyone, and because of which even the yogic stances is a lot of, since 5,000 years it has started from sages, but still yoga is existing because of its effect on the human body, both on the physical and the mental level. To mention few, when we practice yoga regularly, we can attain a physical health, we can attain a mental health, and the sleep quality is also in. Suppose people who are regularly practicing yoga, we see the changes in electroencephalogram, we can see that alpha waves are increased, which shows that our mental stress is reduced. And we see that by practicing yoga, cortisol level is decreased, again which helps to reduce the stress. And more required in this, especially lockdown period or in this pandemic, where by practicing yoga, different variations of yoga, meditation, pranayama, which helps to release the happy hormones. So happy hormones like serotonin, dopamine, all this. Even it helps to reduce the inflammations. Sometimes when before the disease begins, we call it as prevention is better than cure. So it helps to control the disease. But some of the cases where complications can be avoided by regular practice of yoga. In this, even inflammation to how it helps, like by regular practice of yoga, interleukin 2, interleukin 6, C-reactive protein and pro-inflammatory cytokines are reduced, which enhances our immunity. And in this COVID-19 pandemic, by regular practice of Kapalabhati, Vastrika Pranayama and Bhramari Pranayama, which increases nitric oxide, thereby it increases immunity and strengthens our respiratory system. Dr. Kashinath sir was elaborately telling about how why respiratory system, yoga, pranayama, mudras, why it is important and how it is helpful in each stages. So in the now at this eve of like today we are conducting that is this year we are conducting 7th International Yoga Day. The first International Yoga Day was conducted on June 21st, 2015. Then our Honorable Prime Minister, he kept this proposal in front of all the nations. There were around 177 countries who accepted International Yoga Day. This is because of its importance. Why now yoga has accepted globally. And Honorable Prime Minister in his Mann Ki Baat, he has said during this pandemic time, that is COVID-19 pandemic, especially we know everybody knows now we are talking about the black fungus, yellow fungus, all this, before which the main concentration was immunity improvement and the strengthening the respiratory system. So Prime Minister appealed to all the people, like everyone should follow pranayama in their daily routine because that helps for enhancing our immune system as well as strengthening our respiratory system. So we practice International Yoga Day on June 21st. The reason behind this June 21st is this is considered as the longest day in the Northern Hemisphere. And that is why now since a long 7 years, yoga has reached to the mass globally, and every one of us either because these 2 years we are more with the virtual media, otherwise everywhere we can see that yoga has reached to the public reach home. Every home yoga has reached. This year concept, this year theme of yoga day is be with yoga, be at home. So by staying very safe at home, we can practice yoga. So we are seeing that now there are a lot of research scholars, there are many students in this webinar. So it's all of our duty that you have to take yoga very interestingly and you have to practice, because spare at least 30 minutes of time for yourself, so that when we practice yoga with dedication, with involvement, sometimes we do practice yoga pranayama, but only physical, it's not mental. So when we practice yoga to get a desired effect of yoga, we need to practice it physically as well as mentally. So with all this, I thank the organizers. My request to all of you is that yoga should not be practiced only for a International Yoga Day. We have to practice it throughout. So one who regularly practice yoga, we can reap its benefits irrespective of the faith, religion, ethnicity, and culture. With all this, I thank Principal of JSS Ayurveda Medical College, Dr. Shathkarmas sir, and Dean, Dr. Rajesh Uppudi sir, Swasthatata Department, Head of the Swasthatata Department, Dr. Sudhakar Reddy sir, Aparna ma'am, and all the organizers for giving me an opportunity. Thank you, one and all.
Thank you, Vanita.
Thank you, ma'am.
Thank you very much.
Thank you, madam.
Yes.
In busy schedule, you have spent half an hour with us. Thank you very much, madam. Sorry for it was late. 4:30 it was.
Not to extend program because it was already 45 minutes late. So I just told the gist of everything, and today's all the sessions were excellent.
Thank you, madam. Thank you very much.
Congratulate your whole team for organizing such a beautiful event. Thank you, sir.
Thank you, madam. Thank you.
Thank you, madam. I now request our Dean, Dr. Rajesh Utkudi, sir, for the presidential address. Sir, please.
Namaste, everyone. Om Shri Shivaratri Sharanama. Now we have come to the end part, and from the morning till evening, we had a very good feast of the yoga knowledge from many stalwarts, including chief guest of the valedictory, Dr. Vanita Shetty also. So yoga is reaching every home of the world. Previously, we used to say it is only restricted to the India, born in India, spreading throughout the world. Last year, it has crossed around 200 countries. Probably this year, it may cross 250 also. So in the beginning, 6 years back, the countries which have opposed the yoga to introduce in their country, they welcomed with the red carpet. So, you see, it is, I can say that world technology has given 3G, 4G, 5G with the taking the lot of money, funding. But yoga is such a great thing which is gifted to world by India freely. Everybody. See, it is such a technology. By practicing yoga, mind and body become equilibrium status. And especially this year's theme, unity and wellness. Definitely, unity is necessary to fight against the pandemic. Wellness is necessary to stay home, to be healthy mind. So I think, yeah, from yesterday we started add-on course for the first years. They are the beginners for this new course. Last year, they were in the PUC 2 and suffered with the lockdown pandemic. And they had a dreams of joining new college as a professional college. They enjoyed 2 months and lockdown started. So to boost their inner conscious and mental status, even physical status, we started add-on course every day 1 hour from the Department of Swastrutta. Yoga, nowadays, it is becoming very famous. And nowadays, even we have seen that many of celebrities, they are putting yoga as a hobbies. Is it, I've seen many celebrities, VIPs, or the stalwarts, in their hobbies, they used to say, I do yoga, half an hour, 1 hour. And one way, it is booming in the market. Another way, some of the non-yogic personalities, they are giving bad name. I've seen that the person who read yoga, he himself called as a doctor of yoga, specialist of yoga. Quackery is also started. Is it? And the persons who have qualified, graduated, or post-graduated, or who did a research, then their name, these quack persons are leading. We have to restrict also that. Because if we don't restrict now, those will boom the market and we people could not do anything sitting mum. Because in Karnataka only, previously hardly 1 or 2 colleges were existing. Now 5 or 6 colleges existing. Another 2-3 colleges are supposed to come by next year. So it shows that people are turning towards yoga. Especially pandemic has given or boosted Ayurveda as well as yoga. People are behind the varieties of Kashaya, And everybody has seen that everybody is practicing some type of yoga, maybe pranayama or asanas or some of the meditation. So everywhere, everyone is practicing. This is a sign of prosperity of the yogic science. And today, especially, the topic selected by the department were amazing, really, on the unity and the evidence-based practice, research, and wellness, definitely. And pandemic has shown that health is wealth. Wealthy people have gone, living everything without health, and everybody is moving behind health nowadays. And that's why we thought that we should create awareness among our students, fraternity, and even faculty. So we organized this international webinar, and very happy to say that it is ending with a success story with all your efforts and all your supports. With these words, I conclude. Thank you, and all.
Thank you, sir. It's time we thank everyone for the smooth conduction of this one-day international webinar, for which I request Dr. Sankangaud Patil, sir, Associate Professor, Department of Swasthavata and Yoga, to render the vote of thanks. Sir, please.
My humble pronouns to lotus feet of His Holiness Jagadguru Sri Shivaratri Deshikendra Mahaswamiji, Sri Kshetra Sutturu. On the eve of International Yoga Day celebration, the Department of PG Studies in the Swasthavata JSS Ayurveda Medical College, Mysuru, have planned to conduct the international webinar in online due to COVID-19 pandemic. This is the time to conclude with a vote of thanks. I, Dr. Sankangoda Patil, before you to render the same. First, I would like to thank wholeheartedly behalf of the institution to our beloved Director of Medical Education, JSS Mahavidyapita, Sri Mahesh R. Sir, for his endless support for this event. Thank you, sir. I would like to thank wholeheartedly behalf of institution, today's chief guest in the valedictory session, Dr. Vanita Shetty, Principal, Always College of Naturopathy, Mudbidri, and Honorable Member of the Academic Council, RGHS Bangalore. Thank you, Madam, for your support and being a part of this event. Thank you very much, Madam. I extend my thanks to today's guest of honor in the inaugural function, Dr. Radhakrishna Ramarao, Principal, GNCYC, Mysuru. Thank you, sir. Thank you very much. I wholeheartedly thanks on the behalf of institution to all the guest speakers, Dr. Arpan Bhatt, Dr. Manjunath Sharma, Dr. Kashinath Samgandi, and Dr. KV Dilip Kumar for sharing your knowledge through the webinar. Thank you, sir. Thank you very much. And I thank behalf of the department to our principal, Dr. Sarveshwarkar sir, and Dean, Dr. Rajesh Utpudi sir, for their direction and support for this event. I extend my thanks to Dr. Madhusudan, Reader, Department of Roganidana, for his wonderful technical support. Thank you, sir. Thank you very much. I thank Dr. Deepa Patil, Coordinator, Undergraduation of JSS AMC Mysuru, for accompanying with us. Thank you, Madam. I thank Dr. P. Sudhakar Reddy, Professor and HOD, Department of PG Studies in Swasthavata, JSS Ayurveda Medical College, for their well-organizing plan for this event. Thank you, sir. Thank you very much. And on behalf of the institution, I extend my thanks wholeheartedly to delegates across the world, students, all the teaching and non-teaching staff, and my colleagues in the Department of Swasthavata, JSS Ayurveda Medical College, Mysuru, and special thanks to Dr. Arpana Madam for their support from the wing of yoga from our hospital, and thank you one and all who have supported directly and indirectly to the event. Thank you one and all.
With this, we come to the end of the International Day of Yoga, the international webinar conducted on the eve of International Day of Yoga.